calling our meeting to order. Our May 12th Cumberland County Board of Commissioners agenda setting conference starts at 1 o'clock. We'd like to run it at 1, so we will call this meeting to order. We will do an invocation and a pledge by Commissioner Lancaster.
Please stand. Heavenly Father, we come to you this day and this moment asking for your guidance. Father, we ask you for your wisdom and your support as we begin this meeting. Father, please give us clear minds with peaceful hearts as we gather together. Bless this meeting, all those present, and those who work and live in our beloved county of Cumberland. Amen.
Amen.
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We've got a extended agenda here today that we will go through and try to get through as yes, okay. And thank all our guests for being here. We got a lot of guests, and so we will be able to move through this. And I know that you don't have to leave a little bit to come back, so I got you. We're not excusing you, but we got you. And so with that, Madam Manager, do you have anything for the agenda?
Yes, sir. I would ask the board to add the request from Bethel State University on the Innovation and Entrepreneurial Hub.
And where do you want to put that, Madam Manager?
Could we put that maybe 3B?
3C?
3C, excuse me.
3C?
3C.
All right. All right, with that addition, can I get an approval of the agenda?
So moved.
Been moved, moved and it's been seconded by Commissioner Council. All those in favor? That is unanimous. That will take us to, you would have gotten the minutes in your April, by email for the April 14th agenda setting conference. If I can get a motion for approval.
motion to approve.
Second.
Been moved by Commissioner Lancaster, seconded by Commissioner Council. All those in favor? That is unanimous. And we're not doing it that way because we've got our assistant clerk, and this is her first time. That's why I'm calling out y'all's names so she doesn't get confused and she can go back and listen to the tape. That takes us to our first consideration of agenda items, the Opiate Settlement Fund Grant Project. Madam Manager.
Yes, sir. This is a follow-up from our morning meeting on May 2nd where Dr. Green is going to provide a little bit more detailed information about the opioid settlement and the process for feedback from the board. Welcome, Dr. Green.
Good afternoon.
Good afternoon, Commissioners. Thank you for having me back this afternoon. I'm going to pull my slides up here. Okay, I can't see that. Oh, thank you. I need some technical help.
There we go.
So I have two items in your packet at your seat. And I just wanted to quickly go over some opioid data that we didn't have in your packet the last meeting. And you have two sheets. One is about our current Cumberland County opioid data. You have a summary of that here on the slide. This data indicates that in Cumberland County from 2019 to 2020, we're seeing an increase in our opioid cases. So in Cumberland County, we've had 68 opioid overdoses, emergency department visits, year-to-date in 2020 in comparison to 52 visits the prior year-to-date. The populations in our community that are disproportionately impacted are those that are adults between the ages of 25 to 64, so our middle age and young adults, and then individuals who identify as white and an American Indian and Alaskan Native. In addition, if we look at those overdose visits for maybe are not only opioids, but are also medications or drugs that could have addictive properties or for dependency potential, we've had 184 of those emergency department visits in comparison to 144 visits year to date.
Ma'am, Mr. Chair,
Oh, I'm sorry, Commissioner Key?
can you go back?
Yes, yes, sir.
The 68 opioid overdose emergency department visits,
Yes, sir.
does that mean came in the back of an ambulance?
Or they could have walked into, somebody could have driven them to, another citizen could have driven them to the visit, yes.
One of the statistics that we hear a lot of is when first responders show up and they give them the Narcan, there's a number of refusals.
Yes.
Okay. Do we track the number of responses to opioid overdoses? Because I'm going to have to believe that number is truly much higher.
Yes.
But people are refusing to go to the emergency room.
Correct, yes.
Do we have any idea?
I do have some idea. I don't have that data in front of me with me today. We're going to be back in June when we talk about the county health rankings to also do a C4 update. And so we have those numbers for how many overdoses that those individuals have responded to. And that number, you're right, is much higher. These are only the people that come to the emergency department and not elsewhere.
Yeah.
Yeah.
And the other thing was individuals who are white, American Indian, what is the correlation there? Because I'm really wondering if is it more poverty, people that are associated with poverty, as opposed to race, or why is that?
Yeah.
Is it more lifestyle, or is it more race?
It's a little bit of everything, so if we have all day. So if we think about where the opioid epidemic started, it started with people getting prescription drugs, and so those might be individuals who are more affluent and have access to a doctor and have access to drugs, and then or to opiates. And then those individuals may switch to other drugs like heroin and other street drugs that are cheaper. And so I think that some of it is, in our community, white individuals tend to be more affluent, and so they have more access to prescription drugs, and then they may switch to these other drugs. So of note, we're starting to see an increase among other racial and ethnic groups that we haven't seen before. So African Americans, Hispanic individuals, we're seeing an increase in those number of opioid overdose visits to the ED in ways that we haven't seen before. And that's because people are not just getting addicted to drugs like we saw in the early 2000s from prescription drugs. Now it's much more fentanyl and heroin, which are much cheaper drugs. So I think it's a combination of race, poverty, lifestyle, all of these pieces kind of roll in together. Access to healthcare are all parts of this challenge.
Okay, for the sake of this presentation, are we considering heroin and fentanyl as opioids?
Yes, so in those numbers, we would include, and on your sheet, I believe that you have a breakdown in your packet of which drugs are those emergency department visits.
Thank you.
Yes.
Can I ask a question?
Yes.
Just because, so I know C4 and all those keep theirs, but could we not, even those who don't go to the emergency room, can't you just figure out which ones use the Narcans that they have and just count those, and then you will know that overdose because they use the Narcan from all of the first responders and from the ambulances. So even if they don't go, that's another way to track that. That's an easy way to track it.
Well, we distribute Narcan more broadly, so.
Well, I know, but I'm just saying for that population, you can get out of that. Those that go out to the public, they're out in the public. But for those first responders, if they're not included in the emergency room department, if they go out there and decide not to go, all you do is count the Narcans they use.
Yeah,
That will give you even a little bit more, that's all I'm saying.
We can get a number of doses of Narcan that have been administered from our first responders. So far, and you'll get more detail about this when we do our C4 update, we've done about 1,000 doses of Narcan, or we've distributed about 1,000 doses of Narcan. That doesn't mean every dose has been used,
Right.
but and some of those were to first responders.
That's right. Thank you.
So we've been through these slides, so I want to, I'll move through these quickly because we'll be back to get some feedback from you, but I want to clarify a few points that we made at the last meeting. We got some clarification from the state on the use of these dollars. And so we've talked already about the landmark opioid settlement and where those dollars come from. And that's $26 billion, billion with a B. $850 million of that is coming to North Carolina, and I should say up to $850 million are coming to North Carolina. That is not an exact figure once the state kind of works through their total amount. And then again, 85% of that is coming to the state, or coming to local and local municipalities and to county government, and then 15% is coming to going to the state. 17 million approximately is coming to Cumberland County government, and in the back of your packet, on the back of the MOU, there is a breakdown of the percentage that each county is getting. And then the city of Bethel is getting approximately $2 million. These funds just show the payment schedules. We can see that some of these dollars are front-loaded and then will even out to about $750,000 over time after the first few years. So one of the asks on your agenda later today is going to be to authorize the spending, and so you'll hear from Vicki Evans later on in the agenda about the authorization and the use of these funds. The use of these funds requires a budget resolution that outlines how the money will be spent, the strategies that you're going to spend money on, and some reporting back to the state. So we're going to do that. Ms. Evans is going to do that agenda item today so we can start receiving those dollars once the checks are cut. We are going to be getting feedback, as we mentioned last time, about the use of option A and option B strategies, and how these dollars might be used, and that's what I want to tell you a little bit about today, is how we're going to do that during our community meetings, and then for the benefit of the public, give the dates and the locations of those meetings. And so we won't do the feedback session from this group today. We know that you have a lengthy agenda ahead of you. And so we will come back once we do the community meetings to get your feedback. We don't want to influence the community on how they're going to decide. So we're going to not do your prioritization today. We want to have the community give their feedback and their input, and then we'll come back to you to get your feedback. I did want to clarify, because at one point, because we've gotten this question a few times about the Naloxone distribution, and we've asked some questions to the state about what will the support from the state be in terms of Naloxone distribution in light of these dollars. So, for example, the health department currently gets funding, and some of our other partners get funding from the state to purchase Naloxone. So we wanted to get clarification about if, with these opioid settlement dollars, is the expectation from the state that these dollars will replace the state dollars? And the answer to that is no. The state will continue to support, but they would like for municipalities and counties to consider this distribution and putting money towards Naloxone distribution. So again, we're going to get some feedback from you at a later date about the strategies and what your thoughts, and we got some great feedback from you at an initial meeting last week. So I want to give you a quick update on some meetings that we've already had. We have been to the JSOC committee meeting a few weeks ago. We went to the sheriff, and we have a follow-up meeting with the sheriff here in a couple of weeks. We did last Friday. We went to the Crisis Collaborative meeting for their feedback on Monday, and this isn't on here, but we were at the JCPC meeting yesterday for feedback already. So Commissioner Adams has heard this presentation once or twice before. So we have upcoming meetings with our C4 team at the end of this month, and we will be working with the Smart Recovery Group next weekend to get some of their feedback for those that have lived experience. And then there are a few other meetings that are upcoming later this month and next month. So these are our community meeting dates, and so we'd invite the public to attend these meetings. We will be doing a press release coming up next week to publicize these meetings. They will be meetings that are open to the public to attend. And then we will also be recording the meetings so that they'll be posted online later for individuals that were not able to attend. We will also be doing some social media push out of these and then doing some invitations to community partners and others around the community stakeholder groups so that they're aware and they can also help us to push this information out. So we'll have one meeting in the city of Fayetteville, we'll have one meeting in Spring Lake, one meeting in Hope Mills, and then one meeting in Eastover where we've identified that as a hot spot for some of our opioid overdoses. So after we complete those, then you're going to do the budget resolution, or that will be presented to you today for consideration. And then we will bring this back, and I anticipate that once we complete the community meetings, the commissioners, there's not a meeting in July, so I anticipate that we'll be back in August or so to get your feedback, and then also to get feedback, and then present you the feedback that we get from the community. And then we will also be able to share those results with the city of Fayetteville as well. So that is all I wanted to give an update on this morning, or this afternoon. Are there questions that I can answer?
Anyone have any questions or comments? Thank you, Dr. Green.
Thank you.
All right, look forward to hearing you at, I guess, the next one that would be it. Madam Manager, that will take us to a presentation on the Continuum of Care update. I think Commissioners Lease and Commissioner Keith requested this, and so I'll take it over to them or to the manager.
I'll just say that we worked with Dee Taylor and also the chairperson, Debbie Brown, of the Continuum of Care, and so they prepared a presentation, and I believe we're going to start with Dee Taylor first, and then they'll be shared with Debbie Brown. Welcome. Thank you.
Thank you.
Good afternoon, Commissioner.
Good afternoon.
As Ms. Cannon mentioned, the Continuum Care Group received a request to provide information to the County Board of Commissioners that would help the commissioners better understand its role in the community. And so I have with me today Ms. Debbie Brown, who is our current COC chair and who has been with the COC for several years now. I will be also presenting some of the information representing the COC lead agency. And so we're hoping that today we can help the board better understand the COC's goals and objectives and how we're doing currently with administering some of our projects in the community and what the future plans holds for our community. And so we get the question, what is this Continuum of Care group? Why do they exist in our community? And so basically what the Continuum of Care group is, it just consists of a coalition of agencies and advocates that dedicate their time to carry out the responsibilities outlined in the program rule established by the U.S. Department of Housing and Urban Development. Its main responsibility is planning and coordinating housing and services for the homeless population in a designated specified geographic service area. So the group, according to HUD, the COC should consist of representatives from various types of organizations that include your nonprofits, city and county local governments, mental health agencies, law enforcement, schools, and so on, just representing a wide variety of services. Now, the COC may or may not be a legal entity. Now, in our community, our COC did obtain its 501c status a few years ago. And so, just to briefly give you a little bit of background on how the COC came into existence, it was introduced to HUD in the mid-90s when Congress codified this law through the HARP Act. And since then, the COC has evolved, and under the McKinney-Vento Act, the 3 programs that HUD was administering were consolidated into one Continuum Care Program grant. And that is the program that several of our programs in our community are funded through today. And also, our COC was established around that same time in the mid-90s, and that is when we submitted our first grant application to HUD. And so across the nation, we have approximately about 400 COCs. In the state of North Carolina, there are 12 COCs. One of those, the Balance Estate, which is the North Carolina Coalition to End Homelessness, actually covers 79 of the smaller counties or the rural areas. And then occasionally you may hear the term lead agency, and basically what that is an entity that is designated by the COC, and the COC authorizes that entity to actually submit grant applications on behalf of the COC. That lead agency also helps with planning and coordinating activities, submitting the required reports to HUD, and also providing technical assistance to the COC and the committees established. Today, our current COC lead agency, again, is Cumberland County through the Community Development Department. The lead agency, though, can be served by any entity, such as a city, county government, or it can be a nonprofit. The Balance Estate, like I mentioned before, or what HUD call it is a unified funding agent, which is basically an entity that serves as the physical sponsor, and they have a direct contract with HUD. And then that entity subcontracts with the organizations in the community. Today, we don't have a unified funding agent. Instead, HUD has a contract directly with the agencies in our community. And as I mentioned before, the 2 main grant programs that we submit on behalf of the COC is the Continuum Care Program Grant and the Emergency Solutions Grant. The COC Program Grant is issued directly from HUD. With the Emergency Solutions Grant, that is a HUD source, but it's passed down through the state, through the Department of Housing and Human Service, Health and Human Services, and then it's issued down to our local level to several agencies. And so right now I'm going to turn it over to Ms. Debbie for her presentation.
Good afternoon. Our COC's mission statement is listed here. As we are about housing the homeless, we have included a word cloud visual of a house with COC agencies listed. Our purpose is to serve HUD's main priorities, which are to operate a functional COC, implement a coordinated entry system, manage HMIS, strategically plan for the COC, and to prepare the annual application for funds. HUD-aligned objectives are listed in this slide for you. I won't review those. You can read those. Our COC organizational chart is given to you. There can be up to 16 total board members and no less than 6. There are 5 committees in which anyone may attend, but active members only may be the committee chairs. The executive committee is made up of the 4 board officers, the county and city ex officio, and then the 5 committee chairs. As mentioned earlier, the COC is a 501c3 and became such in April of 2018.
Our budget from that point forward has been given to you in this slide. Now Dee will continue on with some of our grant information.
Now, as I indicated earlier, through the Continuum Care Program grant, we fund several projects in our community. They are listed here. You have 5 permanent supportive housing programs, 1 transitional housing program, and the supportive services only, which is the coordinated entry program. And you have, I've listed the housing type, the number of units and beds, and the subpopulation, the population that they target, and the amount that they were actually approved by HUD through the fiscal year 2021 Notice of Funding Opportunity. In the last 2 columns, I indicated the number of households or persons they actually served during their last reporting cycle that you see here. And just to give you an idea of what HUD reviews when they, how HUD scores the COC applications when they review each of the applications. These are the main categories that they use. And in your packet, I've included the more detailed subcategories that you will find there. But the main categories that they review are the COC coordination and engagement, where we score, fairly well, and that they're looking at the COC structure and the composition and who all that we have involved in our planning and coordination process. They also reviewed how well we address COVID-19 issues in our community as it relates to serving the homeless population. Criteria we use locally and how we ranked and reviewed those project applications. Our homeless management information system and our data quality. The point in time count, we didn't conduct a unsheltered count in 2021, but we did conduct a shelter count in 2021, and that's where they reviewed that information. System performance, what they're looking at is the return in homelessness, first-time homelessness, length of time homelessness. We tend to have a low number as far as the percentage in return to homelessness or first-time homelessness, thankfully, because of the homeless prevention resources that we have in our community. However, we struggle when it comes to length of time homelessness, mainly because the lack of housing that is affordable to our target population. They have really not too many housing options available that they can afford. So that's where we struggle in our community. When it comes to the coordination with housing and health care, what HUD was looking for is if we had actual formal agreements with entities like our housing authority and the health care area, but we currently do not. We're working on that. And this is just a list of the projects that we was approved for funding and through the Emergency Solutions Grant. And I'll turn it back over to Ms. Deb.
So we have a overview here that illustrates the different components of the COC and how it provides specific resources for the homeless throughout Cumberland County. Each gear connected to the main COC gear represents the cooperation between agencies needed to make the COC successful. There are currently 60-plus agencies, as well as advocates, that are members of the COC. The COC board has determined that the following programs and efforts were a top priority. One area that we realized we must immediately embrace is the moving on strategy. As part of its strategic priority to end homelessness, HUD encourages communities to explore moving on strategies for clients in permanent supportive housing who may no longer need or want the intensive services offered, but continue to need rental assistance to maintain their housing. Moving on strategies rely on partnerships between the continuum of care, permanent supportive housing providers, mainstream housing providers, and HUD-funded multifamily housing providers. The COC realizes there's a bottleneck at the permanent supportive housing and traditional housing level, and we need to start this plan in our community. Through our HMAS system, that is a local information technology system used to collect client-level data and data on the provision of housing and services to homeless individuals and families and persons at risk of homelessness. Each continuum of care is responsible for selecting an HMIS software solution that complies with HUD's data collection, management, and reporting standards. Our HMIS system is Service Point, and the company that manages it for us is MICA, or Michigan Coalition Against Homelessness. Tawana Dawkins is the COC's HMIS administrator. Each year in January, the COC holds its point-in-time count in which the collected data is sent to HUD. We also have to conduct a housing inventory count to submit to HUD along with system performance measures. Monitoring of the administrator and user agencies with HMIS to ensure accurate and quality will be done by our HMIS CE committee. North Carolina State HMIS uses tools that our administrator has developed, sharing those tools with others throughout the state. Agency training opportunities have been increased to help them keep them aware of the updates from HUD and to provide annual renewal training. This program is very successful and is recognized by our state. The point-in-time count is a count of sheltered and unsheltered people experiencing homelessness on a single night in January as required by HUD. The COC performs the point-in-time count in January of each year as required. These numbers are listed here for you. Please note that the numbers presented are only a sample of the characteristics of the homeless population in Cumberland County for this one 24-hour time period. And be advised that our 2022 information are preliminary numbers that are subject to change pending confirmation from HUD. What we gave you is from 2020, 2021, and 2022, and as Ms. Taylor has stated, in 2021, due to COVID, we were only doing the sheltered count. In 2020 and 2022, we did sheltered and unsheltered count.
There's a question from Commissioner.
Quick question, let's come back to that slide that you were just showing. And help, I heard what you said, but tell me again, especially for the purpose of people that's listening to us today. Tell me about those numbers again. What are they for?
What are they for?
Yes.
What HUD does is we have to do a point-in-time count. We go out into the community. We are trying to find every individual that's homeless. What that does is allow them to see just in that 24-hour period whether we're able to capture them all or not. It gives HUD an opportunity to see where we are with our homeless. And then it gives us as a COC the opportunity to be able to pull down funds to assist these individuals.
Okay, so also where it says 2022, is the number 475.
Yes, sir.
So is that the number of cases of homelessness that you have found here in Cumberland County to report to HUD, or what is that?
Good question. What that is on the day that we did the point-in-time count, we found 475 individuals that were homeless during our shelters, in any of our shelters, or that were maybe in the tent or were on the street, wherever.
And 392, the figure that you have there in 2022, is the number of individuals that are not placed in shelters, that's living on the streets here in Cumberland County.
Correct.
Correct, okay. Thank you.
Yes, sir.
You have a question?
I'm sorry.
Commissioner Stewart.
That 392, those were the ones that you found were unsheltered, but more often than not, they probably did not go into all of the woods and things of that nature, correct?
You're asking, were we allowed to do?
I know you're allowed to, but I know it's not safe to do it, and more often than not, you don't go back there, there can be some of the wood areas and things of that nature. So the number could be quite higher.
Right. We were allowed to, HUD did share with us that, say that this is a tent community. We were allowed to go to the edge of that, and if there were folks there, that wanted to come and talk with us, they could. However, we could not go up to that individual tent and or, go in or anything like that.
You got a question from Commissioner Evans?
And Commissioner Stewart, Vice Chair Stewart, thank you for bringing that to the forefront about the tent cities, because there's a number of tent cities out here in Cumberland County. Seems like every time I pass over an overpass, somewhere I see a group of tents there for individuals that are homeless. Now, with that being said, for clarity purposes, what Commissioner Stewart asked is that those individuals that are in those tents are not accounted for as unsheltered individuals, homeless individuals.
Good question. If those individuals remained in their tent, we did not see them, they did not choose to come out, then no, sir, we were not allowed to count them. But, am I missing?
Anyone who is considered unsheltered are those living in the streets, period, that are not in an emergency shelter or transitional housing or permanent housing. These are those who have no place to go. They are abandoned houses, under the bridge, in the woods, on the street, in their car, wherever, that are not in a habitable, in a home, or a shelter, unsheltered.
Ms. Taylor, well, ask me this, please. With the beds that we have here in Cumberland County for shelters, how many beds do we have available for individuals, for unsheltered individuals?
I'll have to refer to our housing inventory chart report that was submitted to HUD. I don't have that in front of me, but according to the number here, we came up with 43 emergency shelter beds that were reported for that day, and 40 transitional housing beds. So that's as far as the point in time count.
Okay, so the number of beds that we have, with the total being 392 that are unsheltered at this point, we do not have enough beds to accommodate those individuals.
No, sir. No, sir.
Okay.
Commissioner Keith?
And that's why our numbers for length of time is homeless is a challenge, trying to maintain.
Let me start by saying I'm the one that asked for this, because quite frankly, I was getting a little confused with the county had a homeless committee, the city had a homeless committee, the county and the city both had a homeless committee, and the continuum of care was nowhere in there. And to Ms. Deb, I think, did you recently take over as a chair, or have you been the chair for a while?
I was elected to the chair position in October of this past year.
But you've been a part of this.
But yes, I've been a part of this.
Hey, just from an outsider looking in,
Yes, sir.
these numbers really are just a number that you have to do for HUD to get a point. They mean nothing. Because, I mean, you can't have this much of a disparity. And I think I heard you say, I'm not sure, that someone that's in a tent is sheltered.
Unsheltered.
Okay, all right, okay. But you don't know, you can't necessarily count them unless you know who's in the tent. So that number could easily be 1,500.
Yes.
Okay, and I'm not saying that it is, but you don't really know, do you?
We can't give an accurate account, no.
Can you even give within 20, 30, 40%? Do you know how many people in our community are, does anybody know how many people in our community are homeless?
This information that we give you for this one day for the count is the best that we can come to. So it's not an accurate count. And to answer your question, no, sir, there's no way really for us to be able to give you a rock solid number.
And we all collectively, I think we all feel like we have a responsibility to do something. But as elected officials, we've got to know what we can do. Just simply saying, we've got to help the homeless, and I think we're looking for a solution, but when you look at 2021, and then all of a sudden, the difference between 2020, 21, and 20, I don't know if you didn't do it, or...
Yeah, remember that in 21, I was sharing that we only did the sheltered because of COVID. We didn't do unsheltered and sheltered. In 20 and 22, we did both.
So again, we don't know. But in all these committee meetings that we have up, and I see the city doing something with their day center, and we're talking about shelters, and I see the programs that you're involved in, but I'm not seeing the day-to-day unsheltered person that when we think of homelessness are the people that we're talking about. We don't really think of homeless people that are in transitional housing like Ashton Woods and some of our Robbins Meadows, but that's where a lot of your focus is working on by your guidelines, correct?
So according to the definition of homelessness, those that are in transitional housing or emergency shelter are still considered homeless.
Right, but that's not, I think collectively as a group, we're unsheltered homeless is shelter, to get in shelter, correct? Isn't that part of our?
Unsheltered is, those that are living out in the streets that need shelter, or permanent housing.
And to the point of affordable housing, all you have to do is look at the market now, and affordable housing is getting harder. Bethel, North Carolina has one of the highest increases in rent. And-
Cumberland County, as a matter of fact, I presented this to the Homeless Advisory Committee. Cumberland County is 85% higher than anywhere else in the state as far as our rent. Yes, sir. So we have no affordable housing, really.
We should have been able to see this coming. I mean, with the moratorium and everything, and Dee and I actually had a conversation about 6 months ago where houses were getting sold out from underneath them and there was nowhere to go. But where is the continuum of care in that section? Because it sounds to me like most of your other work is in another section of homelessness.
I feel like that answer will come with the remaining of our presentation to share with you exactly what our goals, what our future, what we're looking to do.
Now, these are plans. I mean, goals. We have goals all the time. But, okay, thank you. And I've heard that you were very involved, so.
Well, thank you.
Commissioner Stewart.
I did want to say to Commissioner Keith, the CLC is a part of the Cumberland County Fayetteville Homeless Advisory Committee.
Right.
They are a part of it. I thought you said you didn't see them, that we have one, they have one, but they're not involved, and they are involved in that. So I did want to make that note. And also the shelter transition, 40 beds, 40 shelter that you found that particular night, that number seems kind of high to me because if I'm not mistaken, our board report didn't show that we had 40 beds. So that number seems really high to me, meaning that we really only have 2 shelters, the Salvation Army and the Dream Center. And the Dream Center are hosting 21 beds, and tonight, unless it was a white flag night and it was a white flag night.
The care center
Oh,
shelter.
the care, okay. But, so aside from the care center, we only have the 2 shelters, the Dream Center and the Salvation Army. And how many beds, you don't know how many beds the Salvation Army has? I'm thinking about 16.
The last report was, well, so now
They have more now.
I was thinking it was in the
on
40s.
a normal circumstances.
44. You seen 44 beds?
I'll think about what they report.
Okay.
Commissioner Booth.
I have 2 working, yes. And I mean, they count this as, using cots and.
Right.
Thank you for this, and thank you for the presentation. This was very enlightening, but it was also very disheartening. But I've got a lot of questions, but they're real quick. Like, I think you said the board is 6 to 16 by its mandate. How many are on it now?
10.
Okay, thank you. And what is the definition, is there a definition that these 40 organizations all use for homelessness, or does everyone just use the HUD definition?
Everyone has to use the HUD definition.
If they're funded through, if they're funded through the COC and the ESG programs, they have to use the
Okay.
homeless definition.
And where is the HUD definition?
I've actually listed some references at the end of your slide.
Okay.
Where you can actually find information and resources and reports. Because there's different categories in the homeless definition. It's breakdown.
Would you like for me to send that to you?
Okay, it's not the same one the Cumberland County Schools uses, is it?
No, no, sir.
Because they count if child's living with grandma, that child's homeless.
Right, they count those that are.
So that's a real bad issue, and that we probably are undercounting because they're good at finding little nooks and crannies and places that you probably, unless you know it's there, you won't be able to get out and go and say, hey Jimmy, we'd like to talk to you about this, we'd like to help you out. So if they're hidden, we don't see them. But they know because of their federal reports where the child's living, and when it doesn't match up with where the child's home address is, they go, we're living with grandma, and they put an H by it, as a homeless child. I mean, so those, you can't do anything with those. You can't say, well, we need to get funding for 588 homeless children. No, they're all granted. So, but I think that we're really undercounting these, and that's why it's been going on. I didn't know it was going on this long. How many people that you've been involved with that have been helped? I mean, is there a log book? Is there anything like that that says one member has to be a former homeless person? Who is that for the last couple of years? Same person, different person?
On our board,
Yes, ma'am.
Michael Williams is our current.
All right, and just without getting into a lot of his personal information, what was his generic story? Was he a veteran? Was it separated from family? I mean,
I truly do not know that I can answer
Okay.
that effectively for you.
all right, that's fine. But there is one now that he's been there,
He's been on
hospital.
this past year, yes, sir. He began this past year.
Do you know who was on the year before?
We did not have like an individual that was named. There was 2 individuals on our board that hold positions in leadership areas that were formerly homeless that did not want to be recognized as formerly homeless.
Okay, well, that's what do you have like let's see, we have a goal setting meeting once, twice, 15 times a year where we set our goals, and then at least we can look back and say, in January we did this, how are we doing? Do y'all have something we say, get an accurate count other than one day out of the whole year, maybe monthly, go out to the same spots, or try to find where they are? If you get, as you know, you probably know someone personally, it's like, probably Glenn and I probably know, Mr. Shaw do, but they're very personable and will help you help them and help others if you will spend the time with them. So at that one day in time, like I said, it could be a white flag night, it could be the ACC championship game, so your counters aren't going out till after the score's over. I mean, so, and all the homeless people are at Wild Wings watching the game. I mean, so, there's got to be something other than that. Of 365 days, we go, here's how many we have on April 5th. So that's one thing I'd like to see different than just if it's all that HUD requires, doesn't mean that's all we have to do. Okay, that's good. And likewise, I've heard real good things about both of y'all since this became a focus with the 2 of you. So, I don't know who's Batman and who's Robin, but the buzz is that you two get it. So that's a good thing. But this has been going on since the mid-90s. And we just really don't have, I know, like you said, some don't want to be designated, but there ought to be some that, like a former rape victim, will volunteer and become a big advocate in the Rape Crisis Center or something. There's got to be some folks that not are proud of it, but are thankful for it and will then volunteer their time instead of just being homeless, helping people that were like them be like they are now.
We do have, when I said there were 60-plus agencies and advocates, those advocates are formally lived experience individuals. As a matter of fact, our newest member is Iris Nellie Smith, and she has indicated that her desire is to join one of our committees so that she can become an active member with our COC. So we are drawing in individuals with that experience.
That, and I think if they're willing to tell their story, I think that's one thing. It's kind of like if you go to an AA or an NA meeting, someone saying, "Hi, I'm Jimmy, I used to be homeless," and then tells what, especially around here with the veterans, it'll start ringing real true to some folks and say, well, they do care about you. Yeah. So, I wish we could, every year I kind of joke with Dee, I go, "Are you going to bring me a homeless person tomorrow during the budget talk?" And she goes, "No." I go, "They just want to come forward." She goes, "Well, yeah, but most of them are, either they get about there, then we lose them, or something like that. So there's no way you can say, they don't get like a gold star and then they're done." So it's not lifelong, but it's a long-term thing like AA or NA. So
one of the things that I as chair implemented when I came on board was a plan of action for myself that I'm asking our board to hold me accountable to. And I'm doing that for each of our 5 chairs, for our 5 committees. One of the things that I felt like that we as the COC didn't do very well was to promote those individuals that have come through the system and that are now productive citizens, and that I feel like that what our goal is to have a newsletter that will be coming out, also to be coming to the city and to the county to say on their websites, can we have like some airtime, if you will, where we can show an individual being able to say, here's what happened to me and moving forward, that type thing.
if you get on as a follow-up story to animal control, you'll be on every day. So if you can just get the 10-second spin after there, you'll be on there every day. We're waiving fees again because of having to do some remodeling or resurfacing and stuff. So on page 7, it says the lead agency is not the decision-making body for the COC.
Right.
It is.
The board of directors. However, I will share with you that one of the things that we feel like should be, that may not have been, and we're working toward, is that the COC, the actual continuum, should be the decision-making power, and then they present to our board for our final sample of approval.
Okay, and then on 8, that's kind of like showing that everybody's involved and part of the roof,
Yes,
the
sir.
walls, they're like that. And I counted on the chart page that it looks like there's 40 of them that you recognized in there.
The one struggle you have with trying to do agencies, you're talking about,
On the cog wheel.
yes, sir, our gear that are getting ready to go.
Yeah.
Yes, sir. That's just a portion of them. That's not everything. That was, when you're trying to list all of them, we needed to fill or be able to do some more gear so that we can add even further.
Okay, well, that's what I have, 40 agencies.
Mm-hmm.
Don't you think there might be some duplication? That everyone's going to go count. Everyone's going to apply for grants. Everyone's going to, work with the city, work with the county on getting a shelter, getting a transition shelter, getting, if somebody would just actually be in charge of it, you might not have 40 people doing the counts, because that's another thing, you're probably going to get 40 different counts. So that's,
We try to form this collaborative effort so that we can better coordinate with the housing services and reduce that duplication. Now, we can't, of course, we may have some things that we're a little more careful of, that see as a competitive process, but that's the whole idea.
okay. Well, I don't know which of the 40 agencies or which of you who did this. This was amazing. This was so enlightening, especially for something that's been around since the 90s. And I've only been here 6 years, but I hadn't heard anything about it other than a few conversations with Dee.
Yes, sir.
And I didn't know there was 40 plus agencies doing this. It would seem like with that many agencies, personnel, funding, budgets, boards, votes, directors, everything like that, that we'd be able to, bring, sorry, Jimmy, your phone's again, bring Jimmy in and have him tell his story. And, give him some, airtime, board time, or something like that, to maybe ring true to somebody else out there. And I think that's where we either got to do like an AA, NA, HA, and be, Homeless Anonymous or something, but, I just think it's trying to shoot an elephant with a shotgun. It's just not gonna hurt much.
I guess I would ask this, when are your meetings, are they open to the public so that people can go to the meeting and get all of that information? Because I know y'all I've been there before, so if you give us the date and time of your meetings, we would ask everybody that they come and they find out all that information. I will thank you all for the presentation. So if you go ahead and tell us when those meetings are.
Since I asked, can I ask one?
Well, let me finish my thing. Let me
You said, I thought you were releasing them.
No, I'm asking them when they meet.
Oh, I thought you were releasing them, I'm sorry.
If you put me on that list too, it's not on that list.
Yes, sir, I sure will.
If you would give us when you meet and the date and time.
Yes, sir.
Right now, I mean,
Yes, sir. And I'll give it to you right now. We have for our board meetings, they're the fourth Tuesday of the month at 2 o'clock. Our member meetings are the second Wednesday mornings at 10 a.m. And really and truly,
Let's just say on the website, you can find all the information.
fccoc.org.
and I think you were gonna go to your next steps or one of those, further down in your program, in your presentation.
In 2017, HUD published a notice establishing additional requirements for the COC centralized or coordinated assessment system regarding the development and implementation of coordinated entry. This notice established new requirements for COCs and recipients of COC program and emergency solution grants program funding must meet related to the development and use of centralized or coordinated assessment system. It also gave guidance on additional policies that communities should consider incorporating into the written policies and procedures to achieve improved outcomes for people experiencing homelessness. Each COC was expected to establish or update its coordinated entry process with the interim rule and the notice given on January 23rd of 2018. Our coordinated intake processes have undergone an overhaul to include new coordinated entry policies and procedures being written to include all processes used, a more structured approach to the intake process, and clear desired outcomes. This is still a work in progress. However, success has been noted as the initial processes used with our coordinated intake has been revamped with clearer expectations and outcomes for the homeless entering our system. Through this slide, you can see the visual process used by our coordinated entry staff with those who call or with those whom the coordinated staff meet in person. This assessment allows the staff to then then to refer the individual to the resources they need or to shelter. So the COC's goals and strategies are listed for you on this. Note that all goals are centered around improving our coordinated intake processes, increasing the work for ending homelessness in the COC community level, and affordable housing for those experiencing or at risk of becoming homeless. So it is the belief of the COC that in order to eradicate homelessness, the COC, Cumberland County government, Bethel City government must collaborate to ensure each entity's budgets are addressing the homeless needs throughout Cumberland County. Affordable housing through funds from all three entities are utilized in the most effective way, and to delineate roles and responsibilities between the three entities. The other missing piece to ending or eradicating homelessness is the inclusion of the Cape Fear Valley Health Network into our COC workflow. The Fayetteville City Police and Cumberland County Sheriff's Departments are already a part of our workflow, but we do need that health care system. And we feel that this partnership will benefit all parties involved in dealing with the homeless clients. The partnership between our two parties will result in a more effective and efficient services and use of resources.
Anybody got any questions or comments? Commissioner Booth.
Thank you, sir. I'd also like to thank Pearlie Hodges, Peter Lewis, and Devin. You have at the bottom there, the last page.
Commissioner Keith.
Yes, sir.
Again, I want, because I asked for this, to be, in 2001, I sat through a city council meeting as an elected official on a plan to eradicate homelessness. I'll be honest with you, I haven't seen much going on. See, And I think what we're doing is you were trying to work with the homeless population, but I'm not seeing an eradication. If there's ever a program that we should look to totally dissolve, it should be a homelessness program. But it doesn't, it seems like it's growing. Now, we can say all kinds of different ways, but I don't know what success looks like. And fundamentally, I don't understand the idea of being contracted by our community development and getting funding from the county, but your board of directors is making all the decisions. So I don't understand that completely. I know that the county has we paid for someone in that HMIS system for 10 years probably now. Is that the same person that you're talking about?
And I just want to make sure, clarify, the funding that you see, the budget from the COC, we didn't put funding into that. That was funding that was raised by the COC. The account, we didn't put funding into the 501c3 organization.
The county gives no money?
For housing and services, providing help.
What for the COC to operate, does the county give no money? Okay. Well, I noticed your grants went from 32 million to down to 3 million on one of those slides. Is that right? Didn't you have grants in like 332 something? Right at the beginning. I don't believe, it's just from this commissioner's standpoint that I don't know if there's a plan, a coordinated, comprehensive plan between all the agencies, and I put us at the top of it. With the city wanting to put a day center, we're looking for a shelter, and if there's ever going to be an entity, it's supposed to be y'all, but it doesn't seem like there's, the cogwheel has not got everybody working together on it, because I want to help as much as I can too.
Yes, sir.
But I think the people that are unsheltered are kind of getting forgotten a little bit with all the process of affordable housing. Because your answer is affordable housing. We have mental health and substance abuse and all kinds of other problems that cause homelessness, and it doesn't matter. You can put them in a house, but that's not going to fix their issue.
I totally agree.
Okay, so that was, I hope that there's some coordination, because I'd love to see a comprehensive plan.
That was one of the things that I felt like that.
32,000, okay, sorry.
Okay.
32,000.
Yes, sir. Yes, sir. And just for the record, no one on our board makes a dime. We're all volunteers.
That's right. Thank you all so very much. Excellent presentation. Again, your meetings are open. Anybody who wants to attend are welcome to be able to do that. Continue to keep up the good work you do in this community. I tell you, it takes more to be able to volunteer and go do that. It takes a lot of effort, so thank you. All right, that will take us to presentation 3C, I guess, Madam Manager.
Yes, sir, and I asked Wesley Fountain to come forward. He's the Associate Vice Chancellor at Bethel State University. And you may recall last month there was a presentation by Chancellor Allison as well as Robert Van Dien's about their cooperative efforts. Today you have at your seat a letter from Chancellor Allison, a budget request of $250,000. And also there's a funding proposal, a very detailed funding proposal regarding the plan that the university has for the innovation and entrepreneurial hub. And so with that, I'll ask Mr. Fowl to give a few brief words on the proposal.
Right, so again, as the county manager mentioned, Chancellor Allison visited you all a couple of weeks ago, gave you an overview of the hub. I would just emphasize, because the question came up a couple of times when we did the previous presentation. So I want to emphasize that though this is a hub and a center that's going to be run by the university, it's completely 100% outward facing, right? The benefit to our students, of course, they will be participating and engaging in an academic setting. And likewise, our faculty, or the resource, is going to be something that we're providing to the city and the county. And so individuals, small and medium-sized businesses, but again, it's outward facing. That includes EDA, SBTDC and BBLC are the business outreach center. So I did want to emphasize that because it has come up as far as the resource center.
Thank you. Commissioner Booth.
Thanks for the follow-up. The presentation kind of hit the nail on the head. So to get it on forward discussion, I would approve the $250,000 request that was presented last month and follow up this month.
Second.
And Madam Manager, and I guess Commissioner Keith and Commissioner Stewart, and maybe Vicky can, and let's go from here to there too. Kind of the way we did the one at Bethel Tech with the proposal, is it possible, because I guess this is where these funds come from, can we use ARPA funds for this? It's in the census tract, it's for services for minority businesses or businesses in general.
We can look at it, all I see is it says for renovation expenses, that's kind of iffy, but.
I think what we talked about, I think, was for the services that go in there for some of the veterans in our community and some of the services that were there. So, I mean, as it's presented, we can do that,
So
so.
I'll make that part of my motion that we check that availability first.
And we can do that. And move it to the consent agenda. All of those in favor? That's unanimous. Oh, wait a minute. What was that? Oh, we give it, I'm sorry.
I second it.
Oh, okay. All right, thank you. Thank you, Commissioner Stewart. All right, thank you so very much, Mr. Fountain. Tell the Chancellor we say hello. Back up here. Can I vote on that? Can I vote on that? Because I'm the chair of that board. So I will, so I can't vote on that if it comes from the ARPA funds. We can do that on, because he said to see if it comes from that. So if you check on that by Monday, we can clear it up on Monday. Isn't that what we did in that ARPA?
I think you're okay. That's not, FSU is a constituent member of the University of North System.
Okay.
It's not a nonprofit.
I just gotta make sure here, but work out that. All right, so that takes us to consideration of agenda items, the Opiate Settlement Fund Grant, Madam Manager, and I think that's Ms. Evans.
Yes, sir. As Dr. Green mentioned, our funding will be coming in late spring, early summer, and we need to set up a grant project ordinance, and Vicki's going to present that.
Good afternoon, Mr. Chairman and Commissioners. Dr. Green did give a good summary of what we need as far as this grant project ordinance. We have established a special revenue fund to account for this, and the grant project ordinance actually is based on 2 years' worth of the funding. So it totals $3,224,285 and not the full $16.98 million. So we do intend to bring back a budget ordinance amendment to adjust for the strategic priorities by dollar amount when we're ready to do that. And then it'll have to be adjusted for the funds that we are going to be receiving each year through 2038.
That just make sure we don't commingle it as it says, and it has to be that's separate source, I guess.
We don't want to budget for funds that we haven't received yet.
Okay. Commissioner Keith.
Because of the settlement and the way that it's distributed, some of this money is also going to the city of Bethel.
No, they can get on separate, I think.
That's what I mean. Yeah, they're getting $2 million of their separate money. But if we have a comprehensive plan that Dr. Green brought out that incorporates a lot, is there any coordination with the city of Bethel on what they're going to do with their funds? Well, if we're going to let public health be our agency, it seems to me like we don't want to be doing two conflicting things, or, I mean, it's...
I think I can answer that question. So Dr. Green has included members from the city of Bethel on that committee that has met a couple of times, and there are city finance people that are a part of that discussion. And I think their involvement in the committee that Dr. Green has brought together is to ensure that there is not any overlap or duplication.
But that committee cannot dedicate funds.
No, sir, it's the board of commissioners that are going to dedicate funds.
But in the city council,
Yes, sir.
is gonna be doing that also, so although they're at the table, they're not at the table with any financial stake.
No, that's
Okay.
correct.
Well, I would encourage that. I still think we're missing the boat with not having a prevention, a larger prevention portion of it, but.
I mean, I don't think we got any portion yet. I mean, when we do it, come back here, if that's what we want to do, and having talked with the mayor, I know he's looking for the committee and getting the information back from the committee. I don't think they've gotten to the point of not doing it with the county or doing it with the county. They're trying to get that same information. I think Dr. Green's trying to get it. 7 minutes.
So Dr. Green has had conversations with city finance officials, and we are going to share information back and forth. But this budget ordinance that Dick is presenting does not allocate funding for any specific purpose. That will come back to the board, and it will be your decision based on the community feedback.
Yeah, all right. There's no other discussion. I would entertain a motion to do a budget ordinance number B-220136. It's been approved, by a motion by Commissioner Keefe. I get a second. A second by Commissioner Council. All those in favor? Thank you. Thank you, Ms. Evans. That takes us to the naming of the Public Health Board room.
Yes, sir. Mr. Chairman, Commissioner Keefe had asked that we include this on the agenda today. He has an interest in considering naming the Public Health Board room after Dr. Green. And so I'll turn this over to Commissioner Keefe.
Thank you. A little uncomfortable about Green being.
She's gone.
Oh, okay, all right. I did research this. I went through the clerk and I went through the attorney. There is nothing that violates anything in our ordinances. That specifically addresses buildings. I would say that Dr. Green has been one of the most exemplary ambassadors to this county throughout this whole COVID enterprise. And not only did she hit the ground running with just 3 or 4 months under her belt here, she became a benchmark for the state on how to do things right. She was always very factual, very calm, very consistent, very professional, and no other health director that I can remember has probably ever had to go through what she has had to go through. And although her time with us may be short, I think her memory should be longer. So I had asked, other than just an appreciation or recognition, and I like plaques, but I think that this might be more appropriate. I applaud her. I can't believe the work she did. I can't believe how she did it with such grace and professionalism. And so I ask that we consider as a board naming the health department conference room after Dr. Green.
Commissioner Stewart.
I don't think anybody can take away from the phenomenal job that Dr. Green has done. She has bent over backwards. She has showed up. She has worked in, tirelessly. My concern, though, is her being a current employee. It just makes me kind of feel like that we should just go ahead and name this room after Jeanette Council because she's been serving for so long. I mean, we can find. Watch. I mean, yeah. So that's my concern is that she's a current employee, and I'm just not accustomed to things like that happening when somebody is currently an employee. And it just seems like it just began to open up something, and it's not taking away absolutely anything. She has jumped over backwards even for this board because we are some characters, and she has done, she's gone over leaps and bounds.
And I think it's a slippery slope when you do that without a policy. We may need a policy before we do it. Commissioner Booth.
Thank you, sir. Larry will remember this. We did that slippery slope out of the school board. We started naming buildings, football fields, then we just went ahead and said, what the heck? And we went to naming new schools. Then there was even some requests to take the people that don't remember it anymore off the older schools and change that to someone that people might know. And so there is a slippery slope on it, but I tend to agree with Jimmy on this because I don't think we're going to have another, this is like a battle battlefield promotion. You know, she led the charge, she got the troops up the hill, she came back, she carried two of them over her shoulder, and they gave her the Silver Star. I mean, so, I don't think you have to wait till she's no longer in the Army to, you know, to recognize her. So, I can go either way on this, but, you know, when we first met her, there was this little cute little soft-spoken little lady, and she was, and now she's, you know, holding statewide press conferences, and everybody's going, what do they do in Cumberland, you know?
Commissioner Stewart.
And I'm surprised that this didn't come from her board, that I'm being read.
Yes, as a member of our board, and we are deep into COVID activities and everything, but, no, the request did not come to us, and it did not come from us. But what I would like to suggest, if I could, a procedure that we used in naming this courthouse. And I'm not trying to kill it, Jimmy. I mean,
I asked the manager not to put my name on it.
it has nothing to do with you, even though you know the name of the unknown soldier's mama, child. But you come up with some innovative, unusual, well thought out, or whatever kinds of things. But I remember what we went through with naming this courthouse. And Jimmy, she's not gonna die within the next 2 months. If we,
Two commissioners, I'm sorry,
2 commissioners.
and I meant to Commissioner Bruce's point, that when someone does something amazing in the military, you recognize them, not when they retire, not when they die, you recognize them, and it also helps the camaraderie of the people that work with. It was what I thought was an appropriate thing to do. I didn't have any idea that it would.
Yes. Commissioner Stewart.
Again, she's done a phenomenal job, and because it is such a slippery slope, I want to make a motion that we have staff go back and develop some type of policy.
Or the attorney.
Of the attorney, to go back and establish some type of policy where this is included. I know there is a policy for buildings, maybe buildings, but we don't have one for rooms and things of that nature. She's definitely worthy of it, but I think that because it is a slippery slope, we need to make sure that we have something in place.
And I recommend that you would at least follow the process of that, because it is, you know,
Is there a second?
I think,
It's been moved by Commissioner Stewart, second by Commissioner Council. Discussion, Mr. Keith.
This board has moved off of its regular things at its discretion on so many different items that I'm a little frustrated that now we're going to go through a policy that by accordance could easily be 6 months to a year before it all comes back around, that we see it again. I just want to recognize amazing work by a servant of Cumberland County.
And I don't think anybody else does not agree with that, but it's just the process of being able to do that.
I think if you would have brought it forward, Mr. Chairman, that
I don't think so, Mr. Well, and that is really, all those in favor?
No,
All those in favor of the motion?
I just,
All those in favor of the motion? You got Commissioner Lancaster, Commissioner Council, Commissioner Stewart, Commissioner Adams, Commissioner Evans, because he wasn't excused, so he was a yes vote. Those opposed, Commissioner Bruce and Commissioner Keith. Thank you so very much. That takes us to the minimum bid policy. We moved that from last week to this week because of the fact that Mr. Keith wasn't here. I see her over there. And I'm going to let her take a deep breath and come out to the minimum bid policy. So we're going to go to the minimum bid policy. Madam Manager, and I guess that's actually to the attorney.
It's a county attorney.
this will be real quick if you don't mind, sir. I'll just sit here if everyone can hear me, but I have copied and pasted the existing minimum bid policy, which was last revised last year. I didn't realize it was that soon. And to Commissioner Keith's point, I suggested if the board is interested in that, what we do now is just that we follow the statutory requirements, which would only requires advertisement in the general newspaper of general circulation, the Fayetteville Observer. We could easily add to that with additional notice of the intent to accept an offer to be posted on the county's website by a link appearing prominently on the county's homepage, and I think that would give more.
Well, I thought his was, and I'm not gonna speak for Commissioner Keefe, it was about whether you got past tax due bills, you got tax liens or you got tax bills out there, and you making the bids. I'm not gonna speak for you. Commissioner Keefe, I'll let you speak, because shame on yours.
Thank you, Mr. Chair, and I appreciate you laying this obvious here. That was my concern, that there's been times in the past where people were delinquent on taxes and you were selling them property. There is a list right now on our website. Unfortunately, I don't think it's updated to where 30 days out before these things are, and we have some on there that have been on property books since 2000 that are county properties. And right now, I believe the policy is regardless of what the value of the property is, that you're willing to accept the tax lien.
Actually, if you look at the policy board adopted, during the first 5 years, the minimum offer is the amount of the foreclosure judgment or tax value, whichever's less, because we do have some occasionally that the county paid more than the tax value for them, and I don't think there are any of those left now, but we've had some of those. And then after 5 years on the surplus list, the minimum offer to be accepted shall be the estimated cost of advertising for the upset bid process, but not less than $300. So we have so far not sold any lots like that. And then to your issue about if you look at section 8, no sale shall be approved for any bidder who shall become delinquent in property taxes due to Cumberland County after the bidder's bid has been accepted by the Board of Commissioners. No bid shall be accepted from any bidder who owes delinquent property taxes. So those two sections cover, and they're already in the policy. And my office does check each before we bring one to you, we've checked to see if there are any delinquent taxes.
Mr. Chair, if I can follow up.
Good.
If I'm not mistaken, if I look on the website right now, there's not a single property on there that was before 2017, so that's the 5 years. I don't think there's any properties that are in there after 2017. I'm going from memory. But my concern is people with delinquent taxes in Cumberland County buying property in Cumberland County. 2,
That we have it for sale.
yes.
Yeah, I just want to make sure it's clear, so.
The other thing is communicating with the public that these are available. And I just don't think that the Fayetteville Observer is an adequate communication device for a majority of this county. And we've got to get with technology and the day and find out how we can do this better. I don't really care what the minimum required is. I don't care what the communication with the public is.
Is it on the website?
It's a sheet.
I have suggested that there be a link on the homepage so that it's easier to find from the stuff. That's what this policy would amendment.
And each department is responsible for updating their own information.
It should be a link, and not just to a PDF document with all of our, you link it, you can find out what it is. You'll make more money if people can find out what the product,
I'm going to explore it, just to make sure we understand where we are.
So we can link it to the website with no issues. I think the initial step will be a PDF document, sir, and then we can explore, working with GIS, how to map it out, or we'll explore options beyond that, but linking it to the website, we didn't have that done.
I guess one of the issues, one of the things you can do is, what do other counties do? And maybe just ask some of the county managers, the county attorneys or county managers, but they may have their newspapers and stuff.
Everybody publishes in the newspaper have to still.
Whatever happened to the bill that was coming through the General Assembly that you could start doing some of this stuff electronically and didn't have to do it through the newspaper?
I think they had 4 counties, and they may still be participating on a pilot sort of program. The bill, that's all it did.
So I guess, Commissioner Key, where are we in terms of what you were looking for? Did you get the information, or is there some additional information, or?
Well, I had 3 parts to this. One was that the taxes, the other was communication. conversation on the properties with the public. And the third thing was accepting minimum bids. We have gravitated into a way that the first 5 years, we've never, that I recall, had one that has been in the first 5 years, so we always go to the minimum $200 or $300 or the taxes that are owed to the county. And these taxes could have been owed to the county back in 2010 or 4 or whatever. And so there's
Mr. Keith,
yes.
but since this came into, since I've been here, we had never sold one for $300.
No, I know that, but we have sold them for tax value.
Yes, they've all been sold for tax
I know,
value.
because
We've had a few that have been upset, but not very many, but yes, all tax value. I mean, not, excuse me, not tax value, the cost that the county had in the person, the cost of the.
Yes.
Of taking care of doing the whole road.
Mr. Chair, if I can just take one step then, and just say that make a motion that, I don't want people that owe delinquent taxes to be able to.
I think it's in there.
Ms. Keith's number 7 and 8 fully addressed that, and we've had that in effect since this was adopted in early 2021.
I don't think we need a motion to communicate better with the public.
Yeah.
I can handle it. All right, thank you, Mr. Chair.
And that then takes us, Madam Manager, to the discussion of the zero lot line subdivision. I think Commissioner Booth got an email, I got an email on the web, but I got the same email. And then I think Commissioner Keith followed up on it, so,
Yes,
oh,
sir.
we got wrong.
He did. He certainly did, and we put this on the agenda. And I asked Ross to say a few words about zero lot line subdivisions that might help the discussion.
Yeah, so I just know this is a very technical topic. I know some of y'all might know what it is, so I just have like 2 slides, just for the sake of discussion, that everybody is sort of just working for the same type of information about what a zero lot line subdivision is. So a zero lot line subdivision is simply just part of our, it's a regulatory tool that you will find in our subdivision ordinance that allows some measure of flexibility for a developer to be able to cut out lots off of what's called a parent tract. So a parent tract is a big piece of land, and they cut it up into small lots, and that constitutes a subdivision. So I think everybody's got that. This is just a simple definition out of our ordinance of what a zero lot line is. But on its face, it's pretty innocuous, I would say. It's just basically a development that has one or more structures comprising at least 6 individual lots, joint residences, or businesses. But when you dig down deeper into the regulatory language of what a zero lot line is, it does carve out a number of exemptions. So, for example, if somebody comes into the office and says, I want to do a zero lot line subdivision, the ordinance does exempt them from a minimum lot size, the setbacks, any kind of building area or lot width. To be honest with you, when I first came on board here, I had never seen this kind of a standard in any other place I've worked. I will say that. Essentially what it is, or how it's been applied here is, and I can speak on behalf of my staff too, is essentially just write your own development standards for your subdivision. But it's been in our books for a good number of years. It's been used by, by the community who does business with us, and it's pretty popular, as you can probably just imagine. So I think the intent when we looked at it was that if you have challengeable pieces of property that have wetlands, swamps, things like that, the statement from the county is that through this policy is that if you're entitled to X amount of lots, so if you have 10 acres and you're entitled to, let's just say 10 lots, but you can't fit 10 lots onto that piece of tract, we'll let you go smaller, design it smaller, have your setback smaller, be more flexible so you can get what you would otherwise be entitled to on a challengeable piece of land. Does that make sense to everybody? So I just have 2 slides here. Just 2. This is an old subdivision up toward like the Linden area, but you can see it was zoned R15. It's the Thornwall subdivision. The acreage is about 55 acres, but you can see it's a pretty conventional subdivision. I mean, like the lots pretty much look the same. They're all cut out. Under R15, you got to have a minimum of a 15,000 square foot lot size for each one of these lots. This particular example, however, has it's 55 acres. You can put almost 128 lots on here. The number of actual lots they put on here was 46, and the minimum lot size was an acre, but the maximum lot size was 1.39. But they could go down to 15,000 square feet, so they could have theoretically had more but they couldn't go below that floor, if that makes sense, of 15,000 square feet. This next subdivision is a zero lot line that was used in Cypress Crossing. Actually, this is adjacent to a zoning case we have this upcoming month, but it's 26 acres. If you look at the aggregate, they would have been allowed under R15 with a 15,000 square foot minimum lot size to have 62 lots. They have 62 lots. However, there's a wetland. I think this is actually a pretty good example of how this is supposed to be used. It's like you have a wetland that sits in the middle of it, has a swamp, they couldn't be able to get the lots in and so forth. So for example, the perimeter lots you see here, the smallest ones you'll see are 9,600 square feet, which is below the 15,000. But the biggest one is about 36,600 square feet, or 0.84 acres. So it's a variable, but for the most part, the aggregate altogether was 62 lots, which is what they would otherwise be entitled to. So that's all I have for these two. I just want to make sure that we're talking about the zero lot line. Everybody has an understanding about what it's used for and how it applies on a day-to-day basis.
Commissioner Key.
All right. So a little bit of history here is when the building craze was happening. This has probably been on the books since like mid-2000. Yeah. That's when building was crazy and every developer was trying to get every piece of land that they could, and they went with this. Basically what Rawls is saying is if they get a zero lot line development, the developer controls everything that's inside them, right?
They have the ability to design pretty much what they want.
He could have crammed all of those houses into 25% of that if it's physically possible the way it is now, right?
Yes, as long as you don't go below what the aggregate is.
That's
Right.
So we have nothing to say about this. Now what's happening with us as a group is the zero lot line is still on the books. When somebody says R40, there's an expectation that is one every 40,000 square foot. And I've been very consistent and said to somebody's in R40, but if they don't do that, if we didn't put those restrictions in every single time, they can put 4 lots on one of these lots and have everything crammed into one side.
It's the one with the A1, the A1, but it's zero lot line, and she's going to do a zero lot line on the
You're taking away the rural aspect of all of these places. You're turning them into urban patio homes at the possibility of it. Not only do you want to allow a developer to come in, but you have to consider the surrounding area. The zero lot line is not appropriate in a rural setting.
That's correct.
And it should not be allowed, and I believe
Well,
at the
only
time.
unless it's approved, when you look at it by going through the process, we shouldn't be just do it by yourself. Just go ahead and say, hey, I do a zero lot line.
If I'm not mistaken, on this one that we were all contacted on, I believe it's A1.
It is A1.
It's A1, and they are putting all of these things in probably, what, 20% of the property?
Right, that's what they were doing. I think,
I'd have to go check, but that makes sense.
sort of like that, yeah.
Yeah.
The owner's still gonna live on it all back behind all the woods and the little wraparound driveway.
Well-
You're just gonna jam a bunch of houses right here for income producers.
Well, I mean, like, like the way staff looks at it is we have 2 standards in our ordinance. We think one of them is not used enough. It's a conservation subdivision standard, which if you're going to do these kind of small lots like this, the theory is that you permanently conserve the perimeter of all the remainder land. What's going on is I definitely think some of the developers will come in on a piece-by-piece basis that said they'll take a parent tract, and this is a sticking point with staff. We definitely agree that there's some issue with our ordinance with that, is they'll carve out a little piece on the front, do a zero lot line, then come in about 8 months or a year later, and then say, well, I got this parent tract, I'm going to do it over here for this big 200-acre tract. We definitely don't think that that is suitable for rural standards.
I just think it puts us in a very tough spot to the public because the requirement is out there and we have the ability for them to do that.
Right.
Can we discern against a rural environment and an urbanized or something that's in an MIA? But I've been consistent and I've seen the paradox of staff recommending, because it's on the books, the developer doing it, and they don't, and the public losing their mind when they see zero lot line development coming into their which they should.
Commissioner Council, sorry.
I've heard you, over the years with this. Why have we not requested that it be updated
Well, this was brought to us by one of the board members thinking this was, and I think, it's just been sitting out there. So I guess the question is to fix it, because I think it's a problem. And so,
well, it's a matter of expediency, Commissioner. So, I put in the budget for this year to have our subdivision ordinance updated. The thing about zero lot line and the fact that it's been in our cultural institution for so many years is that there are tentacles that stretch just from the subdivision ordinance. When you mention this, it goes to our zoning ordinance. It's mentioned there. I would like to dig a little further just to make sure that I don't cut off my nose and spite our face if we just do a change to the subdivision ordinance and then all of a sudden it pulls tentacles in other places that might have some effects that we don't probably
but
want
then
to.
the problem you get into is if I think you feel about to change it, I'm gonna go in there and start doing it right now before you change the ordinance, and then, I mean, I don't know how long that takes, but the problem you got, unless you just put a moratorium on zero lot lines, then we just do a moratorium until we come back with the ordinance. So, if somebody wants to, if that's, I guess that's doable, if somebody want to make a motion to put a moratorium on those zero lot lines, go ahead.
No, actually, that's something I brought up, but I know some folks are a little bit, have like these things about moratorium, but it's an option.
Commissioner Council. Well, he just said we can do the moratorium.
Mr. Chairman, you would need direction to staff that you want to remove this, zero lot line as an option in the ordinance and establish a moratorium until this ordinance is brought up to date.
That's your motion. 6 months, report back. Is 6 months going to give you enough time to get it back to us on?
When you say get back, are you talking about a report to get back or a text amendment to get back to you?
An ordinance, either an ordinance rewrite or dropping it, or at least letting you know what it's all going to, you said that it goes over here, you want to make sure you're not affecting something with this one that gives a different backdoor, a different hardship.
Right.
You want to make sure that it's fair all the way around, but, yeah, it's my understanding that right now, they can go in and get the approval from you and then go start building. There's no notice to the surrounding property owners or nothing. And it just seems crazy to me that less restrictive stuff, we have to have notice, the people next would have to have notice, but if you're just gonna go ahead and jam it, you just jam it, don't tell anybody anything.
Can we do 3 months, at least bring it back? If it's not ready, at least we know that, but that gives you some clearance, as opposed to 6 months, which you already did.
Just modify the 3 months moratorium or report back from you, and we'll see what we're gonna do within 90 days.
Okay, so it's a report back, because the direction I heard, just make sure I'm,
And don't put a moratorium on it, don't do what.
Yeah.
You're directing staff to get the ordinance amended, bring back an amended ordinance to remove zero lot line as an option and put a moratorium in place until that is done. I think we can, what Rawls is talking about is a rewrite of the entire ordinance.
Subdivision, yeah.
We can take care of this before you do that. I mean, we can take care of getting this portion out. It's not
That's a
something.
moratorium, if it's unanimous by way of the consent agenda.
So can we,
I would direct that we do that, this portion within 3
well,
months.
for the clerk, let's make the motion clear, so she had it in her motion, because we said a whole lot of stuff. So what's the motion?
Move it, effective board approval, that there be a moratorium for 90 days on zero lot line development.
But you have to have the reason for the moratorium.
Let me do this, let me finish up with the attorney, because he's adding something else to make sure we got it legally.
You have to state the reason for the moratorium and direct staff to update the ordinance to eliminate zero lot line as an option, development option.
Right, okay.
Okay?
That's your motion.
Yes.
You got that, madam? Okay, and you got the second from Commissioner Council. All those in favor? Oh, yeah. All right.
All right, this is unanimous. It was
It goes to the
unanimous.
consent. It goes to the consent. All right.
Thank you.
So don't bring this in.
I'm sorry?
Just don't bring this in anymore.
I'll do that. All right, Madam Manager, the contract for the recycling center fire protection improvement.
Yes, I'll recognize our solid waste director, Ms. Amanda Potter.
Put the files out.
Yes, I do. So this is for an award of a contract for replacing the existing sprinkler system in what we call the recycling center. That was formerly the baling facility at Ann Street. That is the location where we bale cardboard and palletize electronics and prepare recycling commodities for shipment.
And shrink. Like a
And shred. Yes, we do.
So for you all who got all that stuff at your house, y'all can take it up there and get it shredded on Tuesday.
That's right.
Just on Tuesday. Don't go past Tuesday.
That's
Say when, and you got to pay for it. You gotta
right.
win.
It's 35 cents.
35 cents a pound. It's much cheaper than that.
The current system needs replacement because of corrosion and age, and we'll be replacing it with a new system with nitrogen generators, which will help with the corrosion issue. And the system has been designed to accommodate the current use and can be improved for other uses in the future.
All right, anybody got any questions? Otherwise, I'll entertain a motion. The contract, all right. Been moved to second. All those in favor? All right. Madam Manager, that takes us to the request to apply for U.S. Department of Transportation.
Yes, sir. We have with us today Mr. Ross Howard, but we also have Hank Graham, who's the director of FAMPA, and I think
Are you going to do FNG?
they are going to do F&G.
And then what we'll do is take a break after G. Everybody, so like, just put with F and the G. I let you stay, but I know Hank was ready to go.
All right. I'm actually going to try to punt this to Hank, but just as a kickoff, so FAMPO and the planning department, FAMPO have been looking into a USDOT grant to look at upgrading some of our transit technologies, essentially going into things such as tablets and scheduling and just upgrading generally how we schedule our transit services, so we have the money that's available, and I'll let Mr. Graham go into the specifics of what the grant actually is.
Thank you. Good afternoon. So we received an additional, we've been receiving lots of notices of funding opportunities from the Federal Highway Administration and the Federal Transit Administration since January of this year. This was a notice, a funding opportunity of $2.9 billion from the United States Department of Transportation to improve, as Ross stated, micro-transit opportunities for various public transportation systems throughout the country. In the state of North Carolina, they are proposing to, I guess, fund 10 prototype or 10 transit systems as examples or samples to implement this microtransit technology. And as Ross stated, it would allow the purchase of and installation of technology improvements so that our transit consultants or the firms that we provide our CTP services from with technology that would help them operate the system and provide services more effectively and efficiently.
All right, you've heard that. Any questions, comment? Otherwise, I'll take a motion to apply for the U.S. Department of Transportation's multimodal project discretionary grant. Been moved by Commissioner Stewart. Oh, got a question?
I've been getting all these things from the VW settlement.
Yeah.
Are you guys on that? Because it seems to me like this could be right in line with this.
We are, but that's a different pot of money. That was $92 million. And it's in the statement. There's applications and funding available for that as well. FAMPO staff is coordinating with various private property owners throughout the area or throughout the FAMPO region to allow them or get them to apply for that funding. It's like if you own a service station or you own a hotel or a hotel property, you can apply for those grant funds as well and receive, receive an 80-20.
Right. And FAMPO has some funds for electric car. And so if you want to do some electric cars.
But this VW settlement, it seemed like it's specifically targeted like government agencies where you could put EV charging, Jeanette was way above her time. 10 years ago, she was trying to get electric vehicles in there. But, you know, why wouldn't we have them at the courthouse? Why wouldn't we have them?
I've talked to Fanpo about Spring Lake and the
The library should have them.
Yeah.
I mean, everything.
Fanpo's moving toward that. And they don't have to use the BW grants, they got the money to be able to do that. Can I get a second for that motion? Second. It's being moved by, you made the motion, you can't second it again, Commissioner Chancellor. Second by Commissioner Key. All those in favor? That's unanimous. That'll take us to the, request to apply, F-23 community transportation bid.
I was just telling them about anywhere. So, it's that time of the year again, Commissioners, where we're looking at our transit provider contracts. So we had a really good turnout. This COVID episode really taught us a lot about how we provide transit during these types of events. And I think it's fair to say that we took the opportunity, I always say, don't let a good crisis go to waste. So we took the opportunity to be able to look at our contracts and be able to look at everything that we deal with as far as trying to negotiate rates. So the contracts that we're working on right now that we're asking the chairman to sign are essentially, we went out with an RFP. We actually have grown our contracts now from 2 to 3. We have 3 providers that are now here. We had a sit-down meeting with the providers and said, look, the contracts are not going to go for 3 years, that are going to be renewable every year up to 3 years. So barring any kind of changes internally within that 3 years, you won't be seeing this again until year 3. So we asked them to take a look at their rates. We were also looking at standards in the contract related to emergency situations, gubernatorial declarations, things of all that nature to make sure that we're trying to cover as many bases as we can. And the good thing about that is that we got the rates where we think the vendors think they need to be. We still think they're still below market when we look at all the vendors that are, you know, in other urban areas, but they're still higher than what they have been historically. And yeah, that's about it.
So why are we lowering?
I'm sorry?
Why are we?
Well, we went to them and we say, look, you know, you run your business, you tell us what it's going to take. We had people come to us about gas prices, all of this. And so I say, just be thinking about 2 to 3 years out. And again, it's their business model. We asked them what the rate should be. So they went from, we went from a $24.50 per trip. I think we're now averaging, I think 2 of them are going to do $30 per trip, and then one is asking for $34 per trip.
It's high, but I was just looking at the other urban areas. I mean, I'm not saying if that's what they asked for.
We were pretty clear on that.
Yeah, I had a couple of people, hopefully y'all got some new on the RFP, because people in the community have been talking about, there's some new transportation companies that have emerged in the county. If I can get a motion to approve the transportation bid for those 3. It's been moved by Commissioner Stewart, second by Commissioner Council. All those in favor? That is unanimous.
Thank you, Commissioner.
And so that will take a 10-minute break and come back at 3 o'clock. And we're back. Thanks for that break, I tell you. Everybody needs one every now and then. And so we will continue on, which puts us at 4H, the parking lot renewal with First Presbyterian Church.
Yes,
Madam Manager.
Yes, sir. Mr. Jackson handles the leases for the county, and he's going to walk through H, I, and J, all of the leases today.
Good afternoon, Mr. Chairman and Commissioners. This particular lease is with First Presbyterian Church of Fayetteville. It's for 111 parking spaces. It's the parking lot across from the courthouse, the backside of the courthouse or the side of the courthouse, whichever perspective you have, on the other side of Person Street. It's time to renew this lease. The lease renewal is proposed to last 5 years, starting July 1st of 2022, at an annual rate of $21,000 a year. The county will be responsible for traffic control, mowing, landscaping, cleaning, and repair of any potholes. The church will maintain the lighting and utilities for the lighting.
Can I ask a question?
Yes.
How many of those, have we ever gone out there and looked to see how many of those we actually use? I know there's another one right next to the left side that they can rent, and I know a lot of people rent there, so how many of those spaces we actually using? And we used to use a lot of them, but I'll tell you, the court system has slowed down some, so.
Right, I can't answer that question.
So we just continue just to renew it without making any kind of, whether it's actually needed. I guess it's.
Other than the visual of people parking there and walking across the street to get to the courthouse, I mean, that's anecdotal, that's not scientific, but there are people that park there.
Anybody got any questions or comments? We've got a motion by Commissioner Council to approve the renewal of the lease. And a second by Commissioner Lancaster. All those in favor? Mr. Jackson. Oh, wait a minute. So you got Commissioner Lancaster, Commissioner Council, Commissioner Stewart, Adams, and Booth. And those opposed?
I'm only opposing because we don't know if we need it.
Right. I just asked the questions. Opposed by Commissioner Keith. And so that takes us next to the intent to lease the property to Service Source.
Okay, thank you. I'm going to pull up an aerial view. Try to maintain Service Source is a nonprofit organization, and information about their organization and its work is included in the agenda packet. Joining us today, we have Andy Ryan, who's a Senior VP and Executive Director with Service Source, and Jim Richter, who's their Regional Operations Manager. Service Source had a 10-year lease for $1 a year for the property located at 600 and 620 Ames Street in Fayetteville, which is aerial map shows. They desire to utilize the following buildings. So if you take a look at this aerial map, this is Bragg Boulevard, this is Ames Street, building A, B, and C, which A is the main office building, B is the overflow office space, C is the training building. They do not desire anymore to use D, which is an old barn, and which basically were older metal buildings that were previously used for, I believe, woodworking, metalworking. They do desire to continue using this building here, which was referred to as a contract closeout building. As far as the lease options, the potential lease options.
Let me ask you a question, because this is, and I'm not a manager, and I think Commissioner Stewart was probably in on those discussions. To the right of that is where you got Washington Drive, and you've got the city has some land, the county has some land, and Fayetteville State has some land. And there is a discussion about what to do with all of that land. So actually, taking out those 3 buildings with the X actually helps, because we can then possibly cut off some of the that property from Service Source, but the building FE gives a problem. That just kind of stops you from doing anything with the property. So the question is, could that be, the E, be moved to where that first X is and use some of that back property to be able to help with whatever happens down there in, with that renovation down there on the southern end of Mercer Road and Washington Drive?
So it's a good question. I can touch on that, and then if Mr. Ryan wants to elaborate or if I misspeak. I believe that if they finish some other renovations and upfits to some of the buildings further up the hill, that there is a possibility of them not needing this anymore. But do you want to speak?
Yeah, it's like, so we're actually, what we're proposing
You
is.
go to the map, I was thinking, because you need to be at the
Okay.
microphone anyway.
Okay,
You
thank
be
you.
at the microphone because everybody can't hear you if you're not at the microphone.
Yeah, thank you,
Oh, you're
Commissioner,
welcome.
for allowing me to speak.
Yes, sir. I'm just trying to make sure we can help everybody.
So, yeah, the Building E actually is contract closed out, so that there's veterans with disabilities there that work, that do federal processing of contracts. I think you were out a couple months
Right, I was.
ago.
Mhm.
So, yeah, we could over time, the plan was to redevelop, get some more parking space here. I think it was 20 additional parking spaces. Actually expand Building A.
Right.
And we're looking about expansion of about 2,500 additional square feet, probably minimally an additional investment of about $600,000 in capital that would come from us to do this. And so if we did that, yeah, ideally over time, we could be able to move out of that building if needed, you know. You mentioned, and I'd be remiss without saying this, you know, it struck me when you talked about, we've been talking about this since 2000.
Kind of move toward that microphone a bit.
We've been talking about the issue of homelessness and affordable housing in the county since 2001. Michael, you said you've been here 6 years. In the time we've talked about this, we've actually developed housing for about 300 veterans that were homeless with disabilities in Florida. We envision a public-private partnership with the county to meet the community need for affordable housing and homelessness. We actually operate and manage 305 HUD housing units throughout the country. We actually have some in the county, but that, when you're talking about development here, there's actually, if you look at the two exits here, even this little strip potentially, could be a parcel that could be developed to meet the need for housing, affordable housing. I know FSU owns this lot, and they're looking at that, but we're actively engaged with economic development right now. We're talking about developing affordable housing. We're looking at minimally 80 to 100 units of affordable housing. And specific with, and it's not just putting people in housing, but it's the wraparound supports, the three prongs of housing permanency, recovery, self-sufficiency. And we do all three of those. We do employment services, we do housing, we do peer support. Michael, you asked, could we bring someone that was homeless in here to talk with you? Yeah, we have trained peer support specialists that were homeless. Yeah, and our employees. I don't want to get off topic.
I used to be on that board a long time ago. It's been a long time since I've been on that. So Tracy, I mean, that would be, and Madam Manager, you know, as we had those discussions, where we might have some discussion about that back part, because Service Source does a tremendous job for the community for what they do. Commissioner Booth.
Thank you. I think the two, you're saying the same thing, but you didn't pick a date. You know, you didn't, you're talking about if we could eventually get that when we start figuring out what to do with it, and he said, eventually we can get out of it.
Yeah. Well, it's our property, so. So when we draw the lease.
Well, I know, now you won't have to take that. You said, you know, like to go out with you.
We'll have that conversation.
Nobody said, all right, we'll give it to E, and you can have it lock, stock, and barrel on or about.
Well, I guess they got to build something. So I guess that's why he put.
Yeah, I mean, there reconsideration, I mean, it's in our strategic plan here, wanting to do this housing. I'm sorry. It's in our strategic plan here with great specificity We've done the market study. We know what the need is in this community. It's been vetted, validated with the city and county as far as your strategic plan. It aligns with what you're looking to do. I
wasn't about putting affordable housing in this,
Yeah.
right in that part, so.
But if you want a specific, exit time built into the lease, is that specifically what you're asking?
Well,
Yeah.
I don't care. I don't have any input on these committees that are looking to do something with Bethel State and the development of the Berkson Road corridor or anything. So I don't know what the need is for E, but you said we're planning on giving out, and he said we might be planning on doing something with it. I don't want to leave here, if you think 9 years out of the next 10 is good, he's thinking within the next year. That's why I just thought, y'all like dance a little more.
Yeah.
Conversation.
Yes.
Yes. Okay. Commissioner Keith.
Real quick, and I have none of the people of service for it. The only thing that strikes me is that they're going to invest in the capital of the property, and it's county money, it'll stay with the property. But we also shouldn't just rely on, that's our plan. I mean, to build another $600,000 investment into the property.
Oh, then?
Yes. Right. I'm talking specifically about the lease. We went off in the affordable housing.
Yeah, we did.
I'm talking specifically about the lease. Andy, what's the commitment of this $600,000 investment in the property?
Well, right now, we're spending $166,000 a year annually on maintenance and capital improvements in the facility. We spent $1 million in the last 6 years. We spent $1.5 million in the last 6 years when you include our foundation dollars to support the programs that are underfunded in the county. So we already have.
That's recently.
All right.
Yeah, so to answer your question succinctly, our commitment is to continue to fund and invest that capital investment in this maintenance improvements in this campus. And that $600,000 really reflects what we've been doing for the last 10 years.
So if I was to make a recommendation that we have a lease agreement of more than $1 a year, but substantially less, that maybe reverts back to $1 a year when you make the actual investment, how confident are you in that? Do you understand what I was asking?
Yeah, something like
I guess
that.
yeah.
I guess, we did it, and I don't want to speak on behalf of Tracy and Jeffrey, but they did, you really, in a lot of ways, just cost shifting the burden back to the county for maintenance, capital. And we really respect and honor the opportunity to be at the property. I'm simply saying, you're asking me, we're fully committed. We have to expand our space. We have ADA compliance requirements we have to do for bathrooms. These buildings you're looking at, building A is basically a warehouse that's been converted into office space. The building up here, building C is actually a converted whole bathhouse. So there's, to answer your question succinctly, we're committed to investing approximately, $600,000, but it's not all going to be in 1 year. It'd probably be staggered over the next few years to get these improvements done.
The way I feel is, in the past, you rent for $1, you have to have some obligation for maintenance and repair of where it goes in, because we're going to do it for $1 a year. But the only question I was asking was, if you're going to invest in the property that's county property, I see the benefit to both of us.
Yeah.
Okay? But if you're just saying that, we're going to do it over the next 10 years, and then we're sitting here in year 8, and we say, we decided not to do it, I mean...
No, we're talking short-term time frame in the next couple of years. I don't know if you have the PowerPoint of all that. Yeah, okay. But the point, you look at building A, we spent just in the last couple of years, $95,000 to replace the entire roof. Doing every year for the last 10 years. My point to you is we'll continue to do that every year. The short-term thing is the 2,500 square feet, the additional 20 parking spaces, and doing that in the short term in the next few years.
I don't want to get too deep, but we just rented some property to another nonprofit. That was $15 a square foot, but that included other things. And I think $15 a square foot would kill you.
Yeah.
Because you're investing in other things. But at what point is it beneficial for service sources, beneficial for the county, and that we can count on additional capital improvement? That's my only question.
Yeah,
I'm
well,
not trying to get too deep into it.
Yeah, that's our commitment. It's not just, I want to be clear, our ongoing average per year in capital maintenance has been $166,000 per year. We're on top of that committed to do this short-term capital investment of approximately $600,000 to build out additional office space, enlarge the parking lot.
Can you, in 2 minutes or less,
Yes.
because everybody talking about service source, we're talking about lease, what does service source do? And who are their clients, just in the short, because everybody who's watching us may not know.
We serve 2,700 individuals with disabilities annually. We employ over 300 individuals with disabilities in the community. It saves the county government $6.6 million per year in employing individuals with disabilities. They're not drawing on SSI, SSD, SNAP benefits, cash benefits. It's a savings. It's an increase. Our payroll per year is $9 million for these individuals working. It creates sales revenue, tax revenue. Core services are housing, employment. We do rehabilitation services, which is counseling and therapeutic services. And when I say we serve individuals with disabilities, that's a broad continuum. That's vets with disabilities, intellectual, developmental, mental health, substance use disorders.
Average age?
Typically between probably 25 to 35. We're also in all 11 high schools for pre-employment transitional students that ensure students graduating out don't graduate to the couch, but graduate to a job. And our whole primary thing is about recovery, self-sufficiency, and housing permanency.
Thank you. I wasn't just adding anything. I just, people don't necessarily know what service source does. So if anybody doesn't have any other questions or comments, I would entertain a motion.
What's the recommendation?
I thought you did the lease agreement. Well, the lease was in the packet. That's why. But go ahead, Tracy. Oh, I'm sorry.
Get some more information.
Go ahead. I thought we had lease in there, but go ahead.
So what we're bringing to you today actually is a resolution of intent to lease. So because they're a nonprofit, we actually have to advertise this in advance, and it has to go out, and there's a process involved with it. So not knowing what the terms of the lease would be, we had proposed some options for you. If you want, currently, they're leasing 44,022 square feet at $1 a year for 10 years. They cover utilities, janitorial, maintenance of buildings and grounds. Option one, if you want to keep it the same but reduce the square footage based on what they're requesting, would be a term of 10 years, 23,622 square feet for $1 a year. They still maintain utilities, janitorial, and maintenance of buildings and grounds. Option two was their request, which was for 15 years, the 23,622 square feet at $1 a year. They maintain utilities, janitorial, maintenance of buildings and grounds, except the building exteriors. And then just another option that we put out there as staff, Commissioner Keefe mentioned the $15 per square foot. This is not commercial office space. This is renovated space that's been turned into office space and other functions, okay? So we approached the FCEDC and asked them for some comparables in terms of square footage out there in the market. And what we came up with was a range of prices based on this type of use for these types of facilities. And what we arrived at that appeared to be a fair value for the use was $9 a square foot for conditioned space, of which 20,382 square feet of that is air conditioned. and $4 a square foot for unconditioned space, which 3,240 of it is unconditioned. And then utilities and janitorial only, which this is very similar to other contracts that we have with lessees for space in the county. But the county would be responsible for maintenance of all the buildings and grounds, and this is similar to other leases. And that would be a substantial expense potentially, just in terms of talking to our facilities folks. They think that it would be about $28,500 annually, but that does not include replacing end-of-life building systems, like air conditioning units, et cetera. So that's a range of options, and staff really to the board for guidance on where they would like to go with this. We've heard a lot of different discussions over the years about the lease agreements that we have with different organizations. So rather than staff just bringing you one option, we want to try to bring you a couple of options to consider.
Commissioner Stewart, I think you had a question.
So option one, it says accept the building exterior, so.
Well, option one would be the 10 years, the square footage that they're requesting, still $1 a year, but they still maintain all the maintenance responsibilities that they have now.
So the only thing that changed was the square footage.
Right, I struck out the building exterior. That was an error there on that particular option.
It's an error, you said?
Yes, sir. Yes, ma'am.
So it's the same, option one is the same as the current?
Right.
What's the error?
Take out the except the building exterior. I've marked it out here. I'm sorry.
Yeah, take out.
So for option one, it would be utilities, janitorial, maintenance of buildings and period.
Okay. Okay, I'd like to make a motion is that we would use option one to accept the 10-year lease, which includes utility, janitorial, and maintenance of the buildings.
Is there a second?
I'm sorry to hear the motion.
Option one.
Option one. Okay. I got discussion.
Okay, let's get the second, and then we have discussion. Got a second by Commissioner Council. Commissioner Keith.
Discussion is this, 100% we do not want to take the exterior of the building because that is roofs, everything else. Right, we do not want to.
So that's out.
Yeah, sorry, Andy. The roofs on those properties can be thousands and thousands and thousands.
We already, for every building in the front.
So, I would like for ServiceSource to invest in the building and capital as it is now too. And I really don't have it. I don't like dollar a year leases, but is there a possibility that we could base it on a higher dollar per square foot that is credited back with capital investment into the property? Does anybody follow what that is? That if within 3 years they invest $600,000 into new capital in the property, then it reverts to the dollar per year. If not, because the reality is ServiceSource can say that's our intention, but things happen and they don't do it. And we've sort of got a verbal commitment, but not anything else. It's just my thoughts on it.
Commissioner Booth.
Thank you, sir. And 9 times out of 10, I agree with Jimmy on that. I'm not a real big fan of the dollar a year things because it's not productive. And we have several places now that people have gotten out of. But knowing a little bit more about this particular tenant than I do the others, I know they're ramping up rather than running out. So the fact that they're contributing to the community by being in the community, I'd like them to be our tenant so I can go along with the extending the lease for the $1 a year.
All right, so you've heard the motion. I know Commissioner Keith is on his phone, but all of those in favor of the motion? That's Commissioner Lancaster, Commissioner Council, Commissioner Stewart, Commissioner Adams, Commissioner Booth. Those opposed? All right, well, the motion carries. We'll figure out whether I'm trying to be. All right, so it's a resolution on the intent to lease the property division resource. Thank you. Appreciate
for your time.
Thank you. And maybe, Madam Manager, at some point, and he just gave us a short overview, he won't be long, but we can do a presentation for Service Source, and you can bring some pictures and maybe tell some of the things that are going on, just like you did, but a little bit more, but not a whole lot more.
Yeah, in 10 minutes, I'd really appreciate the opportunity to speak to all the commissioners, and really appreciate your time.
But the manager will get with you.
Yeah,
Thank you.
Make sure you get some photos of your folks who out bragging for day, they're the safest people we use.
Yeah.
Everybody out there lunch, that's a real tearjerker.
Thank you very much.
All right, thank you. All right, Mr. Tracy.
All right, the last lease agreement that we have is an intent to lease real property to the Vision Resource Center Incorporated. As you're aware, the VRC is a nonprofit organization that provides services to the visually impaired. Currently, they lease 2,752 square feet, located at 2736 Cedar Creek Road, and that building's known as the Halfin House. We did include some potential lease renewal options for you, at least a couple. One is renewing the current lease for $2,400 a year for 3 years, which is the current terms. Or if you decide to charge a per square foot rate per year, you can incorporate that into the resolution. And again, just looking to the board for guidance on how they want to approach this.
Commissioner Booth.
Thank you, sir. They're very optimistic about they're going to have no traveling issues with the city providing a bus ride out there. Did that materialize?
They actually have a van or a bus that they use. They have transportation through a grant that they got.
Okay, because
They paved it out there. They got a paved trail out there.
I think they had a really, downtown Grove, they had some opportunity to kind of get up and travel around familiar areas rather than Cedar Creek Road had they, because I think if you remember, we were trying to find a place downtown, they said, no, we like that place. You sure?
Commissioner Stewart and I were out there,
Just put that other property closer.
and from talking to their board and their director, they lived out there. They liked it out there.
I believe we were new, sorry.
When we made this lease, there was really nothing out of the industrial park, but it's now full.
They brought people out there, huh? Boy, that was a good move on our part, yes.
If they still want it, I'll still decide to let them have it out there, Cedar Creek Road to serve to the Vision Resource Center.
Commissioner Booth made the motion, Commissioner Council second. Any discussion? If not, all those in favor? All those opposed? Commissioner Keefe, for
Most of the record, my description was cut off by Commissioner Booth.
okay. Thank you. All right, this is the amendments to the OVO policy. Water super.
Yes, sir.
You got a lot of candy, didn't you?
Yes, sir. Actually, Mr. Walker is going to present amendments to the Beverly Hills Park Water and Sewer District, as well as the Northwest Water and Sewer.
Thank you, Madam Manager. Good afternoon, Commissioners. Just briefly, the current rate structure for the Over Hills Parks sewer system came into being in 2018, and the rates have not been adjusted since then. And so in order for the system to be viable, to meet regular routine operations and maintenance costs, and also to be able to fund future capital costs, we propose a rate increase, and that increase would then increase at 5% per year for the next 3 years in order for the system to continue to be viable.
Are there any questions or comments? And we had it went from 1050 to 1150 looks like, from, yeah, and the flat rate sewer usage went from 2450 to 2550. Any discussion? If not, I'll entertain a motion. No, this is the motion for the Overhill Parks Water and Sewer Divisions. That's to increase it, as the proposed increase rate in 5% over the next 3 years. If I can get that motion, that's your motion. It's a motion by Commissioner Council, second by Commissioner Stewart. All of those in favor? All right, that takes us to the Norcross Water and Sewer District.
Yes, so with the Norcross sewer system, once again, we did the analysis and determined that we also needed to increase the usage rates in order to meet operation and maintenance costs, costs for electricity, and then costs for chemical treatment and capital improvements. And also to add, when we met with the Norcross Advisory Board, the board recommended to increase the deposit fee from $100 to $150.
Oh, it's not in the rate, it's just, that's what you're recommending, because that's not in, I don't see it in the rate description.
No, Mr. Chairman, it's not in the rate, but, correct me if I'm wrong. It's not in the rate, but.
It's not in the rate. We actually, but as a part of the fee, total fee structure, which is attached in the attachment. So Mr. Walker, Ms. Amy Hall, and I met with the three mayors, Wade, Falcon, and Godwin, that make up the Norcross board. We did that Monday evening, and they reviewed this, and they sell water to customers within their township, and their water deposit is $100. It when, yes, $150, excuse me, their water is $150, sewer's $100, and it creates some difficulties because the rates are inconsistent, and they ask that it be moved to $150. Plus, if someone leaves, sewer's expensive, it may take 2 or 3 months, and $100 may not be enough to recover 2 or 3 months of the sewer bill if they don't pay the
So
fine.
it's 150, because he said 100, so it's going to 150.
Yes.
100 to 150, okay. And so you've seen the proposed rate increase plus the 100 to 150, if I can get a motion for that.
With their recommendation, I'd like a motion to approve.
All right, the second, been moved by Commissioner Lancaster, second by Commissioner Council. Any discussion? If not, all of those in favor? That is unanimous. I'll go to the consent agenda.
Thank you, Commissioners.
That takes us to the request of Law Officer Katie White for a refund. Mr. Attorney. Mr. Moorfield.
This is, both these next two items, the law office and single source real estate, they are for counties have excise taxes that were paid on recordings that were done in error. I have reviewed all the documents, the Measure D recommends this, these. I have reviewed all the documents that are relevant to these, and I recommend it too. Your action would be to go ahead, but if you approve it, to put it on the consent agenda subject to one of these taxpayers requesting a hearing. They won't, since if you recommend it, but everything is over with these.
Commissioner Booth.
Mr. Chairman, I move that we authorize the request of refund for the office of Katie White, item M, and also the request of single source real estate services. Refund excise tax, item N.
That takes care of L and M. Is there a second to that motion? Second. No, that takes care of M and N. I'm sorry, M and N. Is there got a second by Commissioner Council? Any discussion? Otherwise, all those in favor? That is unanimous. Thank you. And that takes us to the Art Committee recommendations. Just for, as Ms. Jackson's coming forward, all of these policies is what will allow us to be able to move forward on dispersing some of those funds. The chairman of that committee, Mr. Keefe, and Commissioner Stewart and Commissioner Adams unanimously approved those resolutions and those policies. It's just the policies to be able to do it, to stay in line with the federal government and the state government in terms of that. And I think the request was that these be approved and moved to the consent agenda. Is there a motion for that? It's been moved. We got a second. All of those in favor? Thank you, Ms. Jackson.
Quickest presentation ever.
Then we have the other items. Does anybody, Madam Mayor, I thought that was the site report. If you were interested, you could ask
There's
questions.
several other items.
I see it now.
So,
I didn't see the back. I got to flip over. There we go.
we need to get the grants complete. So Commissioner Keith had asked for a report on competitive grants. Sally is actually remote, several states away, and she has put quite a bit of work into gathering information on what the grants that we applied for and received or didn't receive in fiscal year 2020, and then what we've already applied for. So, welcome, Sally. I'm going to turn the presentation.
Is that the new grandmother?
Yeah.
But that's why she grinning so from ear to ear. Congratulations to all of the family. And
go get the baby so we can see it.
All right, Miss Sal, it's on you.
Okay. I hope you can see the grants report in front of me. Commissioner Keith had asked for a grants report showing grants the county had applied for since fiscal year 2020. The report showed that $7.5 million had been awarded to county departments, and the report is broken down per department. And then the second part of the report was grants that have recently been applied for or that are in the planning stages for the next 3 to 6 months. And of that total, $23.5 million has been applied for. In some of those, I'll kind of go over. $2.4 million is part of the congressional directed spending request that we have seeking replacement radios and handheld devices for the sheriff's office. Also, $3 million, of course, has been applied for by Brightspeed for the GRADE grant. You heard from Hank Graham earlier about the $500,000 request for the multimodal projects. And also, as mentioned about, Commissioner Keith mentioned about the VW settlement grant. And we do, Internal Services has applied for $10,000 to North Carolina Department of Environmental Quality for a grant that will pay for $5,000 per point for 2 ports for the Maurice Braswell Courthouse parking lot. The library has several grants that they have applied for, and then we have public utilities seeking $1.5 million from DEQ for improvements to the Norcrest system, $15 million for Grays Creek Water and Sewer District. Soil and Water Conservation has applied for $836,000 for the State Stream Flow Rehabilitation Assistance Program. In solid waste, $1.7 million to DEQ for stormwater and pond improvements there at the landfill, and $13.8 million for the leachate removal project, and then an additional grant at solid waste is for $1.7 million to upgrade the blower and moisture for the landfill gas collection and treatment improvements. So again, that's $23.5 million that have recently been applied for and submitted or plans to be submitted.
Anybody have any questions, comments? Commissioner Keith, this was,
Sally, thank you, congratulations. It would be nice if we could maybe send a letter to the commissioners knowing when we are awarded a grant. I see them once in a while, but it doesn't seem to be consistent. I had no idea. I think you said we had $7.5 million in grants that we were just awarded. Not sure which departments they went to or anything. It was kind of hard to see the spreadsheet.
You got your computer.
It died, huh? Well, there's no cords here, so I didn't do it. In today's world, all of a sudden in the ARP fund, we know that there is money left. There's a lot of money out there right now. And I think it's just important that we're diligent in applying for it all. I did notice that there's not any 911 services grants being asked for. Are you aware of any?
And I'm having trouble hearing. I apologize for that. For 911 services,
Yes.
I do not. I asked the departments to send me grants that they are applying for within the next 3 months. I think Mr. Booth is there in the room. I see him. So I will ask that he speak to that.
Yeah, I can speak on, there are some emergency management grants that have been applied for through emergency services, building infrastructure, grants through FEMA, as well as some of the state grants for recovery and hazard mitigation related items. There's been not anything recently available. However, Mr. Jackson did share an opportunity yesterday for some emergency operations center 911 grants coming up that we're looking at.
Well, we've been on, I know we applied one time for the new center on telecommunications, and we did get some, but we could have applied every year for that, but we haven't. Is that correct?
That is correct. I mean, that one's kind of challenging as they've already granted us money on that project, and
Sampson County got 10 million. So, and I also noticed, maybe you can help me out, Gene, I don't know if this is you or Tracy, but I've been hearing for a couple of years that we're looking for new radios at some of the volunteer fire departments, and there's a grant right now for the sheriff's office for brand new radios. Was there any option to piggyback on that?
we have already worked that with a lease agreement through the Chiefs Association and Stony Point Fire Department to replace all of those radios through the county grant process, through the county grant fund.
Okay.
From those fire grant taxes, or fire taxes.
I was saying if the grant was available at the federal level.
So, as far as the sheriff's office, that was, a Department of Justice type grant, so that wouldn't have worked for fire, but we have been looking for other opportunities to replace those radios, but rather than waiting, and of course, the fire departments were very eager and interested in getting those replaced as quick as possible, we went the route with the local grant, with the fire taxes.
The grant money that's available. Okay, thank you. Thank you, Mr. Chair.
All right. That will take us, Sally, glad to see you, and enjoy. That will take us to the update on the emergency rental assistance. Oh, Lord, they have mercy, all the people been calling me. Come on up here. I gotta hear this one. Somebody called him yesterday.
So as you know, we transferred the program to the Department of Social Services, and thought it was timely that the Steve can come and give an update.
Good afternoon, and I apologize. I have been fighting laryngitis and not real successful, so I apologize for my voice. So thank you for allowing me time to come talk about the Emergency Rental Assistance Program, which we call ERAP. In February of 2022, the county asked DSS if we would be willing to manage the ERAP program. And of course, we were excited to take over that opportunity. As you know, there are 4 allocations. There's the federal 1 and 2 allocation and the state 1 and 2 allocation. And I managed the federal 1 and 2 allocation. So what I'm talking about now is the state 1 application, which is what we have available to us at DSS. That allocation was accepted by the commissioners for a total of $17,452,503.07, with a total of 10% being allowed to be utilized for administration and for case management. Our goal and our anticipated goal is to expend that $17 million prior to the deadline of September of 2022. Expending that $17 million then allows us to be eligible for the second pot of money for ERA State 2. We have worked with County ITS and County Finance Department over the last 3 months to convert the approximately 5,000 pending completed applications from IAM to DSS, and to create a pathway to determine eligibility, which included development of a platform by ITS and distribute payments for qualified applicants. These pending applications are up to 11 months old and require extensive initial work to locate, review, and receive updated information, which then allows staff to determine eligibility. We began working on these applications the last week of April 2022, which was when our platform, our software platform was completed, and have currently assigned 273 applications of the verified and completed 4,784 pending applications.
Well, can I ask you a question? So those were ones already in the queue, that's 4,000? Or
correct.
So does that take all that $17 million, or is that, well, you may not know because you still.
Yeah, we're very early, and the reason I can't really predict at this point is because of that 273 applications that we've assigned, we've only been able to approve 15 of those 273. We've denied 54, and we have about 204 that are in the processing or pending category. And really what that means is that the worker is reaching out to that individual, either waiting for updated information or is actually in the process of determining eligibility. So that
Can I ask another question?
Sure.
The ones were denied. So I applied months ago, got evicted, but I was asking for the rent for where I was, but I'm in a new place. Do I get something for the new place, or am I kicked out because I got evicted from the other place?
So you would be eligible for prospective rent. And there still has to be an eligibility need. So as an example, if you were in a place and you were behind on your rent, and because your application was not approved, you borrowed money from an individual and became current on your rent, you are no longer eligible for this program.
So I was in a lease. I got evicted. They went to small claims court, got a judgment against me for that rent, which then basically prevents me from getting some other stuff. Are we paying for that where I had applied beforehand so you can clear out that judgment?
If you have a need, so it's based off the need, if there's an unfunded need, meaning rent, utilities, that has not been paid, then you could potentially be eligible. And you'd have to go through the eligibility process. But if you've paid that rent, and you still have a judgment against you, but you've paid, you've made yourself whole, then you're not eligible.
No, I guess what I'm saying is that it's the collateral damage from the process having stopped, and I was in the queue. I told my landlord, I'm in the queue, I'm gonna get my money. Didn't get my money, I got evicted, so there's a judgment, which now prevents me to go from going to some apartments and stuff, because I got this judgment sitting out here. I don't have any money to pay for that. I was trying to get the money from this program to pay for that. Why would we not pay that landlord and clear that debt out? And it may be that the state doesn't have that in their queue, but it seems to me that if we're trying to help these people, If they're gonna move somewhere else, you're not gonna sit out there with a judgment on you, because the landlords, the new landlords, gonna go down and look at the judgment and say, oh, you're a bad risk. And so now you don't get to move in here.
So we potentially can pay the unfunded rent, so the rent that was not paid. If there's any dollar amount assigned to the judgment, we can't do that. So we can't pay court costs, we can't pay those kinds of things, because the federal government doesn't allow
Well, not
it.
court costs, but can you pay the rent part?
We can pay the rent.
Oh, that helps, that's what I'm
Yes,
talking about.
we can
So-
pay the rent if it's not been paid.
Right, okay, so, and then they have to make the rest of it whole by paying the court costs or whatever, but the rent part can't be paid.
And then we can pay prospective rent.
Okay.
So if you need deposits, utility hookups for your new location, we can do that up to 3 months, so we can pay 3 months of rent going forward.
Thank you, that helps. Commissioner,
Thank you. Let's go back to a word that you said not too long ago, potentially, that you could potentially pay. What does that mean?
Well, again, this is an eligibility-based program, so there are eligibility requirements that the federal government has established. So it's a potential eligibility based off completion of all of the forms that are required in order to become eligible. So it's not, there's a category where if you fall in this category, if you've had a loss related to COVID or an impact related to COVID, and you have an unmet need, or rent or utilities, you are then potentially eligible to receive these dollars, provided that you provide your lease agreement or an attestation about your lease, provided you provide your utility bills, provided you haven't paid for utility yet. So potential means that you've met the requirements that the federal government has set out on eligibility.
and you might get it, you might not. It's, but it's requirements.
Because, and the reason I'm asking, because there are people that sit back waiting on to receive these services, and I just don't understand, what are we doing to make it happen for them? I mean, I hear what the federal guidelines are, and I understand we have to follow them or everything, but what are we doing to help them to secure those funds, knowing that they need them?
So that's part of the case management that is authorized under this dollar. So our caseworkers are reaching out to the landlords, are reaching out to the utility companies to receive any of those documents that the tenant is unable to provide. And that's part of case management. We're working through, did you really have an impact to COVID? So let's talk about that. Was there loss of job? Was school closure an impact? Did you have to pull your children out of daycare? So let's look at what that loss occurred and how that occurred as it relates to COVID. That's the case management. So go ahead, right ahead.
Okay, and I understand the case management, I'm not gonna belabor this, I promise you, but say, but say for instance, a person that is renting from someone, and the landlord do not want to deal with the case management, and they just want the individual to handle it. So how does that work?
So we can pay either the tenant or the landlord or the utility company. We just have to have some verification that that individual does have some kind of lease agreement. It can be on a napkin. It doesn't have to be a formal lease agreement. It can be a verbal agreement that there's some kind of lease exchange. But we can pay the tenant, and then the tenant is responsible for then paying the landlord whatever is required. And so that's why we use the word potential, because it's hard for me to say 4,784 people are eligible for the program. They were eligible to apply. We then now have to do the eligibility determination to make sure they qualify for the dollars.
Gotcha.
Okay. So we're in the process of trying to do some of that case management in order to work these 4,784 cases. On top of that, there are approximately 6,000 pending incomplete applications, and those will have to be case managed. But we have decided to prioritize the completed applications first, meaning we have all the information, or most of the information we need, and the submit button was technically clicked. Those 6,000 applications we will get to, but those are not finished application, meaning that individual who submitted the application did not finish their application. Our denial rate is unusually high right now. Usually we would expect to see less people denied and more people approved. But remember, these are very old applications. And so part of what we're running into is that individuals have moved, they've relocated, no longer have a need, and they're no longer residing at the address. So they've been able to meet that need in some fashion. And so those are the reasons why they've been denied. And we're hoping that as we get to applications that were submitted later in the year, that we will see that approval rate increase and that denial rate decrease, because the information will be more current. We are working on issuing award letters for those 15 that we've approved. We do have a meeting with County Finance tomorrow to make sure that all of our processes are in place and that we're able to issue the checks to those individuals, but we do have 15 with award letters pending. Of the 25 positions that you approved are time-limited positions. We have hired an eligibility supervisor to manage the program, a lead worker to help manage the task of the program and to return the phone calls, and have either hired or made recommendations for all the other positions, and have about 5 retiree callbacks that are also helping us out. So again, we've only been processing for about 2 weeks, so we expect those assignments and processes to speed up in the next 2 weeks. And again, our goal is to expend all of State 1 allocations before September 2022, so that we're eligible for the second round of State 2 allocation. So from the staff, on behalf of the staff, we appreciate you all entrusting DSS to take over and manage this program, and certainly open to any other questions.
Thank you, Ms. King. But we're just happy that we got some people approved and we're moving hopefully in the right direction. So, but I would ask, okay, so if we get calls, who do we steer them to? Is there a number? Because we do get these calls and you don't want, but I mean, just because we got these positions, so, and for the public, who to call, so they just call the DSS and all the random numbers and everything.
So we're asking them to go through our call center.
Okay.
Our call center has dedicated individuals who are answering these calls, are able to look up the cases and be able to provide information back to the customer on if it's assigned, where it is in the process, and also approximately where they are in the, what we call a ranking. So we have them, so if they're 4,700, number 4,700, it's going to take us a month or two to get to them. But they're able to talk to them through that, and they're also able to accept any documents. So if we know we're missing a piece of document that would help speed up the process, they're able to tell the customer what that is and to go ahead and submit it.
Do you have that number? Well, you may not know that.
I do not.
I don't know that number. If it's not in my phone, I don't hit it. Can we put that a link on on the website as to the rental assistance and how to get there? Probably it's just easy to email, but if you got the phone number, some people, would rather call than do the email thing. So we can get with PIO and make sure it's on our website, on y'all's website.
And we do have a dedicated email where they can send information and upload documents also that we can put with it. But the portal is not open, so we're not accepting new applications right now.
But those who might have some questions can call them. Commissioner Evans.
And the phones are manned when?
From 7:30 a.m. to 5 p.m. Monday through Friday.
Thank you.
Thank you.
All right, great update. All right, that will take us to the Cumberland County Emergency Center Project Update, Madam Mayor.
Yes, sir. I recognize Mr. Jermaine Walker and also our Emergency Services Director, Gene Booth, will participate in the presentation.
Good afternoon once again, Commissioners. Just to kind of set the stage for some of the information that we're going to talk about. So this project is no different than any project that's going on right now in the world, really. And entity looking for UPSs, just to kind of give you an idea, on the same shipment that our UPS is coming in, Amazon has 200 systems. Tesla has 125. And Apple up in Raleigh has 4. So we're competing against all of those systems, all of those particular large corporations. And so, just to kind of give you another indication, Carolina Panthers practice facility out in Rock Hill, South Carolina, it's so far behind schedule in construction that the UPS vendor has released their system. And we attempted to procure it, but when we did the analysis, we discovered that it was too large for our footprint and the amount of rework that it would have taken. We wouldn't have gained any efficiencies on the back end, and we would have actually come to the same timeline. I know I gave you a lot of information. So essentially, we're talking about the timeline for UPS. We expect the subcomponents to arrive mid-June. That's for the UPS batteries and inverter, and then mid-July for the bypass. And I'll step out of the way and hand over to Mr. Booth to talk about secondary fiber.
But let me ask you one question though. With all of that delay, was under budget?
We're under budget, yes, sir.
Okay. Just want to make sure we're on my budget.
Before I delve into a little bit of, yes.
When the budget comes back up.
Oh, okay. Sorry.
Before we delve into the secondary fiber line, I want to provide a little bit of backup in history why the 911 board is responsible for this piece of the work. Back in late 2019, y'all may be aware that Cumberland County 911 rolled over into the EZNet, the Emergency Services IP network, which is owned by the 911 board in the state of North Carolina. We no longer contract with CenturyLink to provide our 911 lines. The state provides. We're the 12th 911 center to roll over. There's 118 now, with only 8 more PSAPs or public safety answering points within North Carolina that's left to roll into that state system, and they have a deadline to meet for that as well, to have it done. So that's why we made this request. We've been working with the 911 board and AT&T for over a year. They've been monitoring the progress of the building so they would know when to start this project and have everything in tune, in place, and for moving into the building. We kept them updated. They used our updates to determine when they needed to pull the trigger on their certain milestones. We found out just about 3 weeks ago from AT&T and the project manager that the primary fiber is into the building through CenturyLink. The secondary fiber line, and the importance of that secondary fiber line is diverse routing. We don't want the same fiber running parallel in the street anywhere at any point in time as it comes to the building. We want it to come in opposite parts of the building, opposite places within the building. So to provide that diverse contracting or diverse routing, they subcontract with a vendor for that. That vendor came back and told them that due to having to bore under a railroad track, we believe the one on Rayford Road, it's going to be a delay in getting the permits from the railroad company. So it could take as long as up to October, early October, to get that done. If so, that would extend our go live into October. So we've worked with AT&T and the 911 board. We're working to find other alternative methods that are equally diverse. That's very key for us, is whatever option that we come up that may be improved the time, it has to be equally diverse and at no point in time parallel each other during its route to the building from the switching side of the roads.
Anybody have any questions? Commissioner Keith?
Couple questions. Original timeline on this thing was beginning of hurricane season this year. And Jermaine, when you say everybody's having these problems, specifically they may be having some of these problems, but since we started this thing, and we bought this property 4 years ago, since we started this process, the hospital has put up a 4-story building. It's probably going to be open before us.
They've got some delays too on their building. Go ahead.
So, and what I've heard throughout this whole thing is, I went through Hurricane Matthew, you were there with me, Mr. Chairman, and all we heard was how miserable our 911 center was at that time. And we took this proactive stance, we got a building, and sooner or later, it's got to be a little shameful about all these delays that we have, because what I haven't heard is I've heard it's everybody else's fault. I've heard it's the contractor's fault, I've heard it's supply fault, I've heard this. Nobody's ever said, hey, it's the guys we hired's fault. So shouldn't somebody have known some of these problems with the UPS long before now? I mean, shouldn't they? Shouldn't we have known that AT&T and the fiber installation, I don't think that railroad's been used on Rayford Road. Larry, when was the last time you saw a railroad go down Rayford Road? I mean, come on, guys. We're blaming everybody else except us. And it's 4 years. I mean, we got to look in the mirror a little bit here. It's kind of shameful. And now we're talking about December. You ain't get cut that early, Mr. Chairman.
I don't know, that'd be commissioner, probably commissioner. We get it cut.
I mean, sooner or later, it's our fault. Sorry, that's all I have. I'm very emotionally upset at this whole process of the 911. Sampson County got a bigger place, and the original contractor we had is who they got, and they're gonna finish this month, mid-June. Twice as big as ours from the ground up. Half as much money that it came out of the county. So, I know it's uncomfortable, and I'm sorry, but it's very upsetting that we were asked to make sure that our 911 people get a better place, and here we are 6 years later, and still can't open.
And I think Commissioner Stewart and I were in a meeting with Dr. King, and I think Dr. King said it's such much more difficult renovating than building from ground up. I think that was what he said. And, we wasted, not you all, but wait a
Mr. Chairman,
we wasted,
excuses now too.
no, I'm not giving excuses, but we wasted, some of that time with the city of Fayetteville.
1 year.
So, a whole year, yeah. So that takes us to the emergency, the money part. This is the budget part.
Thank you for the responses.
Go ahead, did they go change the?
There ain't any change. No. Why it won't change until we push that it changes?
So the state's 911 board staff recently provided finance staff with training specific to 911 funds and the Emergency Operations Center capital project. And as a result, we have requested some budgetary changes that were included in your packet. So several things are required for this change. So the grant funds and the 911 fund balance revenues and expenditures must be budgeted and accounted for in the 911 fund. So that accounts for a total of $3.351 million that will need to be moved out of the EOC Capital Project Fund and into the 911 fund. So if you don't know this, the 911 fund is a special revenue fund for the county. We also learned that the full $2.251 million grant award is not completely available for reimbursement, and this is why. When the original application was submitted to the 911 board in 2019, the construction costs were estimated at about $10 million. The board computed 911 eligible costs at 22% based on the square footage of 911 functions to the overall square footage of the building. Actual construction contract totals $6.5 million. 22% of that totals $1.4 million, which is the max amount of available grant funds based on the actual construction contract amount. So to offset the approximate $821,000 that is no longer available, we're increasing the debt proceeds revenue budget amount by $1.37 million, which is available. Expenditures in the construction line are being decreased by approximately $1 million and technology by $865,000. Separate from the EOC Capital Project Fund, in the 911 fund, we're adding in the grant award and the 911 fund balance contribution with offsetting expenses in the construction and technology lines. So really what this results in, because we're going to have savings in technology costs, overall, we will not, and we don't have costs that will exceed the current $14.65 million budget. We're actually projected to come in about $500,000 less than that. So we're requesting approval at the May 16th meeting to approve Budget Ordinance Amendment 220053 and 220052.
Commissioner Keith.
I'm sorry. So, what I heard you say, Vicki, was we originally got one grant from 911, and we based that grant upon the total cost of the building, but they would only pay us for the actual cost of the 911 facility in that building. Did I get that right?
It was based on an old construction contract amount from 2019.
But it was based upon the entire facility and not just the 911 portion.
No, the grant was, even back then, the $10 million construction contract estimate that was submitted in the application was multiplied by 22%. And the 22% is based on the 911 portion of the facility compared to the total square footage of the facility.
So it's basically 1/5 of the facility. Now, why are we having to get some of that money back?
Because our actual contract it changed. It's not $10 million. It's about 6.5 million. And so when you take 22% of 6.5 million, it reduces the amount available, and they will not pay us for any amount over that.
So we lost about $1 million. I'm doing it in my head, right?
We lost $821,000.
$821,000, and that was grant money,
Correct.
okay? And that's the only grant money we've really got.
On this project, yes.
Yes. So we no longer have $864,000, so we're having to make it up out of our capital fund.
And no.
Or the 911 board money and fund balance.
See,
That's been budgeted the entire time.
so when we took out the debt issuance, we had available like $14.5 million in debt proceeds. But we hadn't needed all of that because we needed a balanced budget at 16.5 million. So we can fully budget for the debt proceeds that we actually received, and that offsets any decrease in grant funds that we have, and we've gained some.
Okay. I guess my point on this was we totally lost $864,000.
821.
But when we say we're coming in at $500,000 under budget,
On the expense side.
on the expense side, we've lost $800,000 at 65 that we could have put towards it. Now, it's different math, but it's
If it had been with the 911, yeah.
Yes.
So,
You got any other questions?
yeah, open it up.
That's a statement. If I can get a motion to approve the budget ordinance B 220053 and B 220052. Moved by Commissioner Stewart, second by Commissioner Council. All those in favor? That's Commissioner Lancaster, Council, Stewart, Adams, and Evans. All those opposed? And that will be Commissioner Keith.
Thank you.
All righty. You would have the monthly report, so does anybody have any questions or comments about the monthly report? If not, I will entertain a motion to second. Been moved and seconded, all those in favor? That is unanimous. All right.